Good evening and welcome to February's meeting of Customer and Corporate Services and Scrutiny Management Committee. Before we begin, I would just like to remind you that we are being webcast live and recorded for posterity, so please do be sure to say exactly what you mean or it might come back to haunt you. Now, I know we're all familiar with the mechanics of these virtual meetings, but for the benefit of anyone watching for the first time, participants have been asked to keep themselves on mute at all times unless invited to speak, and to indicate their wish to speak by using the raise hand button within Zoom, which is visible to me as chair, but not to the viewing public. I'll be inviting members to contribute in the order that I see their hands going up, unless I see members indicating to speak for the first time when others have asked several questions already. The exception to this is when participants are wishing to make a comment or ask a supplementary question that is pertinent to the specific issue being discussed, as opposed to starting a new line of questioning. And in this instance, participants can draw my attention by waving their hand physically, and I'll bring them in if I can. Members of the committee will be joined on the screen throughout the meeting this evening by Janie Berry, who is the Council's Director of Governance and Monitoring Officer, and by Dawn Steele, who is Head of Civic and Democratic Services. Off screen, there's a Democracy Officer who will be taking minutes, and we also have technical officers supporting us. Additional participants will be joining us at specific points throughout the meeting, and I'll be introducing them as and when they come into view. Now, as members will know, we have a slightly longer agenda for this evening's meeting. And this unfortunately couldn't be avoided due to various pressures. That's part of the reason why we're starting early. But in light of that longer agenda, I would like to ask members that more than ever, if we can target your questions constructively and deliver them succinctly, that will be very much appreciated. I'm going to be looking to take 2 short adjournments this evening, each at an appropriate stage after about an hour's discussion, and that's just to give everyone's eyes a chance to have a rest, not just be staring at a screen all the time. Now, before we begin the meeting proper, I just want to update members because I did promise that I would report back following the call-in meeting that we held on the 25th of January, and specifically on how members of an external body came to have access codes for the meeting when, to the best of my knowledge, they had not been invited. So I would like to just read out a statement that I've prepared in advance of us moving on to the main agenda. So, as I understand it, the facts are as follows. Attendees began joining the Zoom call from 5 p.m. as per usual practice, and there was some discussion during this pre-meeting about whether or not Councillor Waller and Councillor Eyre planned to attend. It was confirmed by Lib Dem committee members that both exec members planned to attend, and approximately 5 minutes before the meeting was due to start, an invite was forwarded to Councillor Eyre by the technical team. Approximately 2 minutes before the meeting began, technical officers confirmed that the only person they were expecting at the meeting who was not currently present was Councillor Eyre. And after a brief discussion, Dawn Steele advised that we would begin the meeting and technical officers could allow Councillor Eyre to join after the meeting had begun, notifying me as chair if and when he did. We began the meeting at 5:30 and shortly afterwards I received a message confirming that Councillor Eyre had indeed joined the meeting. Now, at around about 10 to 6, during Councillor Douglas's presentation as the member leading the call-in, someone appeared on screen and identified themselves as Steve Murrell from Make It York. I hadn't seen him arrive in the waiting room or be admitted and had no idea who he was. Unsure whether or not I'd missed something, I told him it was not the right part of the meeting for him to be appearing and asked him to leave the virtual table. And to be frank, I didn't at this point know what on earth was going on and felt that I needed to get this person off the screen as quickly as I could. Sean Bullock, the chief exec of Make It York, then appeared in the waiting room a minute or 2 later. And if you watch back to the video feed, you can see my confused and contorted reaction when he appeared at the door, as it were. The technical team contacted me to ask if he should also be admitted, and I replied to say not at the moment, being concerned that something unusual was happening. I allowed Councillor Douglas to finish speaking and immediately called an adjournment to urgently try and establish what was going on. I asked the monitoring officer and head of democratic services to join me in a private breakout room as soon as we came off the live feed. And in that private breakout room, Dawn and Janie confirmed that they had not been expecting the attendance of Make It York and were as concerned as I was about how they had come to be in the meeting. The Assistant Director of Communities and Equalities, who I had previously been informed was the lead officer responding to the call-in, was invited to join us in that private breakout room, and he confirmed that he had spoken with Make It York that afternoon, confirming to them that they were not required at the call-in. He also couldn't understand how they had come to be in the meeting. Having confirmed with officers that Make It York were not expected, and having been advised by the monitoring officer that as we were discussing an internal decision of the council and there was no requirement for Make It York to attend, I concluded that it would be inappropriate to allow members of an external organisation to participate in a meeting to which they had not been invited by either officers or the chair. I conveyed this to Sean and Steve, and they left the meeting graciously. We returned to the public broadcast and I explained that Make It York had left the meeting and we continued. Now, I don't wish to go over the remainder of the meeting in detail, but I think suffice to say it didn't reflect particularly well on the council. Immediately after the meeting, I requested that Dawn and Janie, as monitoring officer and head of democratic services, undertake an urgent investigation into how this situation came about. I also suggested that a protocol be implemented with immediate effect such that an agreed list of meeting participants be signed off in advance of any public meetings and a clear instruction be given that no additional persons be admitted to the meeting without the chair's explicit consent. I wrote to Dawn and Janie, copying Ian Floyd on Tuesday morning, reiterating these points and explaining how seriously I took this issue. Janie has subsequently reported back to me that a member of Make It York approached a member of the Democratic Services team after the meeting had begun and requested access details, which were innocently supplied in error. I have separately corresponded with Sean Bullock, Chief Exec of Make It York, who has also confirmed that no formal invitation was extended to Make It York to attend the meeting on the 25th of January. However, he has stated that there was some confusion over whether or not Make It York were asked to attend and insists that his PA contacted Democratic Services before the meeting began. I remain unclear as to why the approach was made to request access details when Make It York had been explicitly told by the Assistant Director of Communities and Equalities earlier in the day that their presence was not required. I am also unclear as to exactly when this approach was made, but I do accept that a member of the Democratic Services support team would have believed that they were acting in good faith in supplying the meeting access codes. I am, however, unconvinced that this happened prior to the meeting commencing, and furthermore, don't understand how Make It York could have known who to approach since the meeting support team are not named publicly. Furthermore, had an approach been made in advance of the meeting commencing, I would have expected this to have been conveyed to me as chair in the pre-meet immediately prior to going to live, as was the case with Councillor Eyre. Now, a new protocol has been drawn up and will be circulated shortly, and as of now, all public meetings will have an agreed attendance sheet circulated in advance to technical staff, to chairs and to vice chairs, and no person will be admitted to the meeting unless their name is not on this list or the chair has given their explicit consent. During the call-in meeting, I made clear that I was not prepared to discuss any details of what had happened in public. This was because at the time I was unclear exactly what had happened, but felt that the intrusion was an incredibly serious matter. As a point of principle, I felt it would not be appropriate to allow external members of an organisation to join a meeting unannounced, and this was within my gift as chair to decide this. I did, however, say that I would be happy to discuss any issues after the meeting in private. No one has subsequently approached me to clarify any points or request further information about my decision making, though I am aware that some emails have been circulated raising questions about my conduct. I must say that I am disappointed by this and the tone of some of the statements made within those emails. I think it's appropriate, therefore, to remind committee members of a few points which are pertinent to the continued functioning of scrutiny. First, the role and purpose of the attendance of these meetings of the Head of Governance and the Head of Democratic Services, who is also the statutory scrutiny officer. They are here to assist with the smooth and legally compliant running of meetings. They advise me as chair on any issues arising and act to assist me in delivering a meeting which accords with both the Council's constitution and any obligations under the Local Government Act and the Localism Act and any other relevant legislation. They will pull me up or intervene if I am doing something untoward, and consequently, if they are not doing so, you can assume that I am acting in line with the legislation, constitution, and/or their advice. Asking statutory officers to reconfirm what a chair has just said to a committee meeting is to publicly question the validity of the chair's prior statement. It has happened more than once of late, and I do take it to be disrespectful to the position of chair. Similarly, asking the monitoring officer to comment upon a chair's performance in a widely circulated email is equally provocative, and in my view can only be interpreted as an attempt to undermine the position of the chair. Now, you'll know that I've taken to reminding committee members of the 4 tenets of good scrutiny in recent months, but I've perhaps failed to remind us of our individual responsibility as committee members and as elected representatives. We are here on behalf of the public to represent their views and assist in decision making that will, we hope, be of benefit to them. As members of Scrutiny, whether from administration or opposition groups, we are specifically here to act as a balance to the executive, and our own website makes this clear, saying, and I quote, "Councillors who are not members of the executive act as watchdogs, examining executive decisions and policies and the overall performance of the council. These non-executive members of the council make recommendations to the executive about improvements for residents. This is known as overview and scrutiny. The process is designed to be non-party political, so committees which undertake overview and scrutiny must be politically balanced. And I note again that this committee is not currently politically balanced. The main role of scrutiny is to hold the executive to account, scrutinising decisions before they are made or implemented, examine implementation of policies, consider the introduction of new policies and their effects, and examine the function of the council's partners, the police or local health service providers. Now, I've said previously, and I will say it again, I'm not here to play games or score points, and I'd like to think that my door is open to anyone who wishes to ask questions or understand more of the background to any of my decision-making as chair. Diplomacy, however, necessitates that this cannot always be done in public, nor can I always give you the full picture, not least as I may not necessarily have it myself. I would like to think that I have the respect of committee members in the job that I do, because without that, this committee and scrutiny overall cannot do its job properly. So we have a choice here. We can either go down a destructive route and all start tearing lumps out of each other, or we can agree to act with decorum and continue with what I believe to date have been largely constructive meetings. I therefore hope that we can draw a line beneath this and move on with the meeting tonight in a constructive and respectful way. In the interest of doing so, and notwithstanding our already busy agenda, I am happy to take any questions on what I've just had to say. Councillor Rowley, I can see your hand is up.
Thank you, Chair. Firstly, I'd like to endorse all that you've said, and thank you for that response. My only slight comment would be in terms of the protocol moving forward, and it's not in any way, shape, or form of criticism. It might have been easier had your meeting with the monitoring officer and the head of democratic services included the vice chair. That might have made it a little bit more balanced. But also moving forward, in terms of the protocol, if that protocol can include that it's the chair and the vice chair who will attend any clarification breakout groups, and I want to offer you my unreserved support as the chair of this group. Thank you.
Thank you very much, Councillor Rowley. That's noted and very much appreciated. I'm not seeing anybody else with any hands raised, so I will move us on. But I would just like to reiterate, I am very happy to discuss any of the points raised if any members wish to contact me privately. So moving on to the main agenda. First of all, apologies. I haven't received any apologies for today's meeting. Item 1 is declarations of interest. So do any members have anything that they wish to declare for this evening's meeting? Not seeing any hands. So item 2 is minutes. We have one set of minutes to agree from this evening's this evening. Again, if anybody has anything that they wish to raise, if you could just give me an indication. I'm not seeing anything, so can I take it that it's fine to sign those as a fair and accurate record? If you could just give me a wave just to indicate that you're happy, that'd be great. Thank you. And I've just noticed the technical team have popped onto the screen. So I presume there's something that I need to address.
Yeah, just in light of what you said, we've got a number of people in the waiting room. So we've got John Tomset, who's expecting, and Trudy Foster. So I just thought I'd...
Sorry, my apologies. I can see the messages now. I was mid-flow, but they are both fine to come into the meeting. Thank you for checking. So I shall move us on to agenda item 3, which is public participation. And as a welcome change, we do actually have somebody who is registered to speak this evening. So we have Ms. Paula Bennison, who is a local resident and would like to speak on agenda item 8, the annual complaints report. John, I see your video switched on, but if you could switch your video off for now, and we will come to you when we get to the appropriate point. Thank you. So, apologies. It's going to be one of those meetings today, isn't it? So yes, agenda item 3, public participation. Paula Bennison, I think you should be with us now. If you just could press *6 to unmute yourself and just say hello, so I know your microphone is working. Ms. Bennison, can you hear me?
Hello.
Ah,
I
fantastic.
Can hear you.
That's great. I've got you there. So you should have had it explained to you, but you have 3 minutes to address committee members. And what I'll do is give you a warning when you're down to your last 30 seconds or so. And so if you'd like to just begin in your own time.
All right. Well, a few issues really to what the meeting's about. Issues, I don't know. Are we talking about issues with the neighbourhood team, or are we talking about issues within the meeting here?
So I had you registered. Sorry, I had you down registered to speak because you wanted to speak to agenda item 8, which is the annual complaints report. So the way this works is you get 3 minutes to raise any points that you wish to raise on that agenda item, and then committee members will take them into account. We can't ask you questions about it, but we'll take into account any points that you raise. And when we reach that agenda item, then members will have those points in mind when they're discussing the item with officers.
Sorry, is it complaints regarding the meetings or complaints within the council?
So the annual complaints report is the a summary of how complaints to the council have been dealt with over the course of the past year.
Right, smashing, logged. Right, that's smashing. Can I proceed?
Yeah. So if you'd like to speak, as I say, you get 3 minutes to address us, and I'll give you a little nod at about 30 seconds to go. So over to you.
All right. All right, yeah, the complaints procedure with the council I find bewildering, really. As a person that put complaints in, it is dealt with, but not in the correct procedure. You put all your logs in, and then the logs can get mislaid or lost, maybe. Then you go back to the council, and they pass you back to the police. Then you pass you back to the council, then you get passed back to the police, and it's like a ping pong. Now, you can be going on that merry-go-round for about 3 years, which I have in my life, and it just goes round and round in circles, and it can make you quite poorly. As for the addressed issue, has it been addressed, and the complaints procedure? I'm now at the stage of a complaints procedure, which then go on to another complaints procedure, and then it proceeds to the ombudsman if you don't get to where you want to be. Or you can take it further, you can get a solicitor yourself independently, or you could go to the House of Commons. I don't know which way you'd go, but depending on the feedback you get from them people, i.e. housing officers, police hubs, enforcement team, etc., etc. But in the 3 years I've dealt with a complaints procedure, it does make a great effect on your mind, which your mind is a powerful thing. And really, if your mind starts and you become out of work, I was a good worker, and then all of a sudden I became ill because of a man that's caused a lot of harassment and hassle, and it just keeps going and going. But at the end of the day, the housing officer has fairly dealt with the procedure, but she could do more in the way of coming back to us on what they're doing for us. They aren't doing enough. To keep the tenants safe within the property, no, I don't agree they have. As for doing cameras and recordings, they have done recordings, but it all seems to get backlashed, and then you have to get a solicitor involved, which costs you money as a tenant. So no, I do think that the council do need to act more on helping tenants, and the Ombudsman is a great thing. Also, IDAS, great help there. But I do think the council do need to push a little bit more on recording things. They're very lax. When you send your recorded delivery diaries of 15 or 13 diaries, they've lost them, or they've misplaced them. Or
You've got about 30 seconds left.
So all I need to say to the council is you need to get your act together and basically get some better staff, or basically try and cooperate more and communicate with the police and everybody else. That's all I've got to say.
Thank you very much, Ms. Bennison, and thank you for taking the time to come this evening. As I said to you, we can't ask questions or go into any specifics, but I'm sure that the councillors present will take your comments into account. And also, if you haven't done so already, I would advise contacting your ward councillors, who may be able to assist you with any issues that you're having with dealing with the council.
Smashing. Thank you very much.
Okay.
Thanks for your time.
Thanks for your time this evening. Thanks. Bye.
Thank you. Bye-bye.
Okay, so I'll move us on then from that. Now, I mentioned in the pre-meet, I'm planning to just take the agenda in a slightly different order to that was published. And so we'd like to move agenda items 8 and 9 up to the top of the meeting. So we'll go to agenda item 8 now. I will be taking them both sort of consecutively, take one, we'll ask some questions, take agenda item 9. But in presenting them, I'd just like to note that both of these papers have already been through CMT, they've been through the Council's Governance and Assurance Group, and they've been through Audit and Governance Committee. So I did contact Councillor Pavlovic as the chair of A&G, just to have a quick discussion in advance of the meeting. He confirmed that his committee were satisfied with the visit that it had there, and what they have done is requested that the new procedures that are being proposed under agenda item 9 will go back through A&G in about 6 months' time so that they can analyse their effectiveness. And so in his view, he was looking for them to go back there first and then might make some recommendations for our committee as to anything that we might want to pick up from that point on. So we're being joined in the meeting now by Kath Murray as the Complaints and Feedback Manager and Lorraine Lunt as Information Governance and Feedback Team Manager. So what I'll do is just hand over to Kath and Lorraine to present agenda item 8, first of all, the annual complaints report, and then we'll invite members to ask any questions.
Okay. Good evening, everybody. Agenda item 8, which is the annual complaints report for the previous reporting year, so from March 2019 to 2020, covers the 3 main areas of complaints and feedback that the council deals with in the complaints service. So that's complaints regarding adult social care, including public health, complaints about council services under the corporate complaints and feedback procedures, the local Government and Social Care Ombudsman and the Housing Ombudsman Service, and children's social care complaints. It doesn't cover any raised concerns or expressions of dissatisfaction that have another appeal or legal route to follow. So, for example, appealing or complaining about getting a parking ticket, etc., that would have its own appeal process, and so isn't dealt with through any of these 3 processes. So, going through the report, I would just like to draw your attention to the larger numbers of complaints isn't always a negative. It can help us reflect that the procedures that we have in place are accessible and that customers and complainants are supported to make complaints, including children and young people, through the children's social care process. And that also provides us all with invaluable feedback. It helps us to review and improve the services that service areas provide and helps us manage and maintain service provision. throughout the report on pages 24, 25, etc., we break down some of the highlights of the figures and performance reported in the full report at Annex 1. Happy to take any comments or questions on those at the end of my brief, hopefully, overview. In children's social care, we are receiving a large number of complaints, but again, that isn't a negative. It just means that the process is accessible and that we support children and young people where we need to, including with the provision of an independent person to that. We have done some work with the children's social care teams and services and managers to determine what was the impact and the lead into this increase in volume of complaints received. It included a significant period of change within that service area. There was resource challenges, but also the actions that we took as a council prior in that service area, following on from the public maladministration report from the local government and social care ombudsman in the previous reporting year. Part of that was to provide a programme of staff training and raising awareness sessions so that we increase their understanding of the complaints procedure and how people and young people and children could access that and take advantage of the options to be supported through the complaints process. A significant area of sustained improvement in that area was that there were no cases where responses weren't sent at stage 2 of that process. That was a significant improvement from the year before. It demonstrates, I believe, the ongoing commitment from senior managers to deal with complaints effectively and use that feedback to learn lessons and improve their service areas. Within corporate complaints, there again were increases in the volume received, but again that will be down to increased awareness, and where that isn't the case and there was no responses received at either stages 1 or 2, we decided to take an approach through the contingency planning in response to the first national lockdown to support service areas in providing an end-to-end service in complaints handling, investigation and responding. We took advantage of that to try and make improvements and to also ensure that where we could learn lessons, both for the service delivery, but also for the proposals at the corporate complaints toolkit that's at the next agenda item. There is also a section within the report around the local government and social care ombudsman's review, but to draw your attention specifically to that in 100% of the cases that reached the LGSCO, they were satisfied that the council had successfully implemented their recommendations, and that in 17% of what were upheld cases by the ombudsman, they'd found that the council had already provided a satisfactory remedy before the complaint had reached them. So that's quite a larger proportion of cases than in other similar authorities. Is there any questions at this point on either the report or the full annual report at Annex 1?
So I'll hand over to members, and I see Councillor Kilbane's hand is up. So Councillor Kilbane.
Thank you, Chair, and thanks Lorraine for very, very thorough reports. In terms of the payments that are made across the 3 different sort of complaint areas, I'm totaling that up to about 17.5 million. Is that in 1 year that's paid out? Is that just for that year, or does that include sort of complaints that have been rumbling on for a number of years, and it's kind of you measure the payments within a financial year, if you see what I'm saying?
Thank you, Councillor. I would have to look into whether they were complaints from a previous reporting year and it was just that the decision was made at that time, and I can circulate a response to all of committee if that would help afterwards.
Councillor Kilbane.
That'd be great. Thanks very much for that. And just in terms of, because obviously 17.5 million seems like quite a lot of money to be paying out to settle complaints. Does that also include any sort of informal financial settlements? So if there's something that's been brought to the attention of a department and they kind of realise, yeah, we were wrong there, you know, it's going to cost 50 quid to put it right, and settling that with the complainant, does that include that in that figure, the 17.5 million?
Sorry, Councillor, I'm just looking for the totals. It's a long time since we wrote this report. So there's the cost for delivering the service. So that's my team's cost, bearing in mind that we also provide the information governance, so all your FOI, EIR, data protection, records management support and advice to the service. There's also the cost for where by legislation we have to provide independent investigating officers and or independent people in amongst social care complaints, and the total cost for that in the year was just over the 60,000, and the cost of the payments made to individuals via either one or all three of the different processes, I don't expect it to be up at 17.5 million. I'm just wondering if I've got a decimal point in the wrong place, or whether I've got my...
Sorry, yeah, no, I've read it wrong. I've read it's 1.5 million, one of them, and it's 1,597.
Oh,
so that's my mistake.
I was panicking a bit there, Councillor Gilbane.
But I still can pull the actual totals into a separate table and put all the costs, etc., over the next couple of weeks and share it with committee.
That's helpful. Just on the informal bit though, so you were saying that the total amount covers your staff cost and various things, and then there's the payouts. And I think Councillor Kilbane was mentioning possibly informal arrangements for very small amounts of money, which I guess I'm not sure quite how we explore that, but it does sound like it's something that is worth exploring. Would that be something that you would necessarily pick up within your team, or would you expect that might be something that's perhaps never quite reaches your door?
It would partly come through our team. Obviously, there's a matrix that the Ombudsman have for working out how much payment, recompense, time and trouble, etc., that they would recommend that the council makes to an individual, and we then have the opportunity to either agree with that or dispute it and take it down the formal appeal process with the LGO. What I would suspect are the informal payments, so that haven't been set by a regulator. We do work around the Ombudsman's matrix of assessing time and trouble, recompense, etc., out-of-pocket expenses. Kath, I don't know if you want to say anything else about the actual day-to-day operational delivery of those.
Yeah, and I think it feeds in quite nicely into the next bit that I think we're going to talk about around kind of how we might be able to work in the future and look at things like remedies more effectively and more quickly, so that we can look at things that can put people back into a position that they would have been in prior to any errors having occurred. And I think that's very much what the Ombudsman expects the complaints process to do, is they expect that the people dealing with complaints are empowered to be able to look at what would be a proportionate and appropriate resolution to something that might have gone wrong, and how do we sort that out for people as quickly and as effectively as we possibly can. So I think that's what we always aim to try and do, and that's the advice that previously we've been given to people. And thankfully, as Lorraine was saying there, on a lot of the Ombudsman's cases, they have looked at a number of times where we've been able to do that effectively. And I think that's something that we would really want to aim to increase, so we can remedy things for people at the point of them coming to us very early.
Thank you for that. I'm not seeing anybody else's hands up at the moment. I just had a couple of quick questions on this, and then if there aren't any further questions, we can move on to agenda item 9. You mentioned about the increase in the number of complaints, and that could be reflective of sort of better processes for enabling people to make a complaint, I suppose. I'm possibly putting words into your mouth slightly there, but I wondered if you could just tell us if there's anything that has changed between last year and the previous year that might sort of mean that it would elicit that extra number of complaints, because it does, on the face of it, seem to be quite a large jump, both in children's and in adult social care.
Yeah, I'll take that one again, Lorraine. I think so for the time period that we're looking at for this annual report, it was in that kind of year and slightly preceding it, we'd done quite a lot of awareness raising, both with managers and making sure managers were aware of how to put things through to us, and making sure that they were also passing that on to customers, so that customers were being told about how to make a complaint. And I think that was really the big side of what was going on there. Particularly, we were targeting some of the children's services. I think people will be aware that we had slightly, preceding this, we'd had a full maladministration case. One of the recommendations from that were about, again, raising awareness and making sure that complaints were responded to appropriately, and that we were able to deal with that as quickly as possible. So we had done quite a lot of awareness raising within those service areas, and from there across the whole of the council.
Thank you. And then just briefly, sort of following on from that, the public speaker, obviously they were talking about an individual experience and their particular case, and I wouldn't want to necessarily get into that here in a public meeting, but they didn't seem to be aware that they could perhaps speak to their local councillor as somebody who could support or help them through the process. And I just wonder whether that is something that you encourage when you're handling complaints from residents, because sometimes we can muddy the waters, but I think I'd like to think that sometimes we can help things along and at least explain the process to the resident if they haven't perhaps been clear on it. So is that something that is encouraged within the various teams to suggest that they do that?
I think, again, certainly in terms of the new way that we're looking at working, I think we see councillors as being a real a partner really in that process, that we would like to work with you around those kind of things, so that we can talk to people about using yourselves as advocates, but we also are using that as part of how we work with services to promote that. So that has happened to some extent, but I think it's something that we would like to be able to take more advantage of in the new way of working.
And you'll see in the next set of papers that there is a section on role for councillors.
Fantastic. Well, I've got Councillor Rowley with his hand up quickly, so I'll just bring you in, and then after that question, perhaps move us on to that next section. So, Councillor Rowley.
Thank you, Chair. And again, I might be preempting the next section. So, thank you, ladies, for what you've given us so far. I'm just looking at the dates of the report from April 2019 to March 2020. So that's going to take in the first the first week to 10 days of the initial COVID lockdown last year. I guess my question has something to do with that, but also with the comment that was made by the public participant. Council services across the board were majorly affected within the first couple of weeks of the first lockdown in terms of trying to get into a new world. So a couple of questions really. One is, are we expecting an increase as a result of COVID and some of the disruptions that we had to council services and in that first lockdown? And then secondly, how robust is the complaints process and procedure now compared to how it might have been slightly ropey at the beginning of the lockdown last year? So just however you want to answer those.
So we are expecting there to be an increase this reporting year cycle on complaints, bearing in mind that complaints are just an expression of dissatisfaction in whatever for us to consider and look at, and to make sure that where we can learn lessons, we can. Where we've maybe got things wrong, we can look to ensure that we don't get the same things wrong again. So there is an expectation that complaints or expressions of dissatisfaction will rise. Also, as we move forward and service areas continue to have to provide services in different ways, in more resource restrictive ways, with capacity and all the restrictions that there are both through a lockdown and then the when we come outside of the other end of a lockdown, there is an expectation that that will increase. Again, because we've seen a steady upward increase trend over years, again, that's due to people's confidence and comfort in being able to approach and how to make a complaint or give feedback to a council. Also, the nature of making it accessible. You will see potentially an upwards trend anyway in an increase in the volumes being received. And that's another reason why we had to take advantage and look at the options for a different way of working and providing the service to the rest of the council services, and also take advantage of looking at, which was nearly a 13-14-year-old procedure for the next agenda item.
Thank you. Councillor Rowley, a quick supplementary there.
It is, thank you, Chair. And my second question, which was how robust now and how confident are you of the robustness of the system now, given the fact that it was alluded to by the public speaker, things getting lost?
Just before you answer that, can I just bring in Janie, who's just waving at
Chair,
me?
Can I answer that? Because actually that might be a question, well, if you don't mind, is more appropriate for the next agenda item, which is about our complaints toolkit. So the fact that we're bringing a toolkit before the committee might be an answer in its question, if that makes sense, Chair. Thank you.
Yeah, that does make sense, and I think Councillor Rowley, you give me a thumbs up that you're happy with that. So yeah, we'll be able to pick that apart on the next item. I've got a couple of hands that have just gone up. So Councillor Fenton, you were next.
Thank you, Chair, and thank you for the report. I was looking at the nature of the increase in in complaints, and I agree that complaints are something that provides an opportunity to improve. I just noticed I think it was on page 45 that two categories where there'd been quite a significant jump was either lack of action or inappropriate action. And I just wondered whether there'd been any sort of further analysis of that as to whether it was a case of things that had been promised not happening, or the customer being unhappy that things that they wanted to see happen weren't happening, for which could have been for a variety of reasons, and including perhaps of unrealistic expectations of what could be delivered. So I just wondered whether there'd been any sort of deep dive into those numbers in particular to better understand what had driven that increase. Thank you.
Again, is that one for me to take?
Yes,
there has been some, and I think it is something that we've seen actually across, again, all service areas, and it's something that we have seen as a pattern, and it's often around things like communication and the ability of staff to potentially respond to customers within an appropriate timescale, not just in terms of complaints, but in terms of communication and updates and those kind of things. And sometimes around the explanations, that what we will sometimes find is staff have a really clear idea about why they're doing something in a particular way, but forgetting sometimes that customers don't necessarily understand why we've taken decisions in the way that we have, and making sure those explanations to people are clear and are timely, and it's those kind of things around lack of action and inappropriate action sometimes, I think, is often communication, to put it simply.
Thank you. I've just got Councillor Musson with her hand up, and then I'm going to close this section and move us on to agenda item 9. So Councillor Musson, if you want to ask your question.
Thanks, Chair. I've actually got a couple. Unfortunately, they'll be quick ones, I hope. So the first is just around discretionary payments or ex gratia payments that we touched on earlier, and that is what sort of ranking officer has the ability to authorise any payments. So how high up do you have to be within the directorate for those to be authorised? And how are these audited and kept track of and made sure that they're all documented and above board? And that applies to both discretionary payments as a result of Ombudsman recommendations and any that the council would take that haven't been recommended by the Ombudsman. And then my second question is, you've included really. Do
you want to hold that question?
Oh, go on. Yeah.
And I'll come back to you. So if you could perhaps answer the first question, and then I'll come back to you.
Kath, do you want to answer that one?
Yeah, so I mean, we would expect really that the complaints team grade complaints, and again, it's something I think we want to come on to a little bit more in the toolkit about how we can do that maybe a little bit more effectively, so that we're not kind of taking complaints and putting them at a lower level if we've already assessed that they may need a payment or they may need a resolution that might need a senior manager, and that we can get it straight to that level of manager. And that certainly the complaints team would have that expertise and specialism of being able to understand what the remedies guidance would be telling us would be the appropriate way of doing that. The Ombudsman guidance in many ways is very simple in the way it describes things, is that it should be putting the customer back into a position they would have been in prior to any mistake being made. And that does sound very simplistic, but actually, as we all know, there can be quite a lot of complications around that, taking into account people's personal circumstances. Lots of things don't necessarily have a straightforward out-of-pocket expense, and it might be about missed opportunities, things that have happened that we've got to then kind of try and backtrack and unpick that. So that would then, that's one of the things in the new toolkit about the complaints team having the expertise to do that, but also talking to the right level of manager to make those agreements so that there is an audit trail, so that it is clear about how that's being done, and also that I think it comes forward to yourselves as part of the reports that we do in the annual report as well, and that's clear and documented in there. I mean, it is clear and documented in there currently, but just about having that better way of being able to quickly make decisions, I think.
And also, just to add to that, we regularly report to audit and governance, and the complaints process was, as it currently stands, internally audited a few years ago with the recommendations from that. So there is a audit evidentiary route for payments to be requested, authorised, and then in payment, and the amounts scrutinised where necessary.
Thank you. And Councillor Musson, I think you had a second question. If you want to just put that quickly, and then if I can just get a couple of succinct answers, hopefully, and then we can move on to agenda item 9.
Yeah, thank you, Chair. So my second question was about service reviews. So you've included a really helpful breakdown of the sort of outcomes in terms of continuous improvement for Ombudsman complaints in that report. And I just wondered if you had a sense, or the team had a sense of, whether or not we are, or individuals are, doing service reviews for complaints that don't go to the Ombudsman, because clearly if something's gone wrong, we want to ensure it doesn't happen again. So do you think that there's effective follow through with complaints to fixing errors like that when it's not asked for by the Ombudsman and part of that resolution procedure? And if there isn't, if we could do better, how could we sort of get people to understand how to do a service review and how they can fix things for other people?
So again, just to answer on, oh, sorry, I'm jumping in there, sorry.
Go for it.
Just to answer that, we can always do better. We do have, as part of the current procedure, what's called a action plan, lessons learned, and the current corporate governance team, which is the really good new name for the complaints and information governance team. So from now on, it's the corporate governance team, are take forward with the service areas through reminders, chase reminders, etc., for them to do action plans from their complaints and also lessons learned. And then that's how we look at the themes. We go back to directorate management teams and corporate management team and look at those recurring themes, recurring actions. Obviously, they're one of the areas where we need to get better at, and which was part of the options for the new toolkit approach as well, and how we can improve that closing the circle and lessons learned from all complaints.
Thank you. So what I'll do now is move us on to agenda item 9, which is Lorraine and Kath both staying with us. And I think you've got a presentation just to set out the new corporate complaints and feedback toolkit. Now, as I mentioned, this has already gone through A&G, and A&G are asking for a review in sort of 6 months' time. So I think I'll take this almost as a, not quite item to note, but if we have the presentation, that should set out what the new complaints and feedback toolkit looks like. If members do have any sort of pressing questions about clarity and what have you, please feel free to ask them. But as I say, there is this review coming in about 6 months' time. And Janie, I can see your hand going up as well.
Chair. So this is something that Lorraine and Kath and I have worked on with the team in quite intense detail. So if any member, I'm just conscious of time, wants to speak to us outside of this meeting, in fact, any councillor wants to speak to us outside of this meeting, because these documents have been circulated quite widely now, we'd be very happy to meet separately and answer questions outside of this meeting as well. We're hopeful. Audit and Governance found the short presentation you're about to see really helpful without having to go across over 100 pages of new documentation. So the presentation is aimed at as a summary, just as you've said, Chair.
Thank you, Janie. That's really helpful. So over to, I'm not sure whether it's Lorraine or Kath that's giving the presentation, but whoever it is, you should be able to. I think Technical have got a screen to share, haven't they?
They do.
Hopefully.
So yeah, that's just our introduction. So it's the Corporate Complaints and Feedback Toolkit, or otherwise known as the 4Cs Toolkit. So if I can have the next slide, please. That's again just the how to contact us and who the team are. So we have complaints and feedback advisors, and we have information governance advisors in the team, as well as Kath and myself. Next slide, please. So the reason that we took the opportunity to review the corporate complaints process and how the team delivered its service was a number of reasons. We needed to ensure it was still fit for purpose, that it met customers' expectations, and that it complied with all the various guidance and best practice that was continuing to come from regulators such as the LGSCO and most recently the Housing Ombudsman as well. The other opportunities that we did was that the current corporate complaints procedure was first written in 2007 and hasn't really been reviewed or updated since. And so taking feedback from customers who have been through the process and where there were sticking points for them, where there was opportunities to make it better, we took that advantage, as well as learning lessons from the, shall I say, fortunate or unfortunate opportunities that the first lockdown and working through the COVID-19 response and recovery phases has given us. Can I have the next slide, please? So the main change is that we're moving from the age-old hierarchical and rigid 3-stage process. It's increasingly criticised both from complainants, users, staff, managers and the regulators that we make individuals go through these 3 rigid hoops before they can reach the regulator or a satisfactory level of outcome. Satisfaction with how it's been handled and satisfaction with how they've been kept up to date, etc. It'll never always, a process and a procedure or a toolkit will not always ensure satisfaction with the outcome. As you can appreciate, there is dissatisfaction with how it's been dealt with, but also dissatisfaction with the outcome. We're moving to a more effective process that's more responsive to the nature of the complaint or correspondence that we've had from an individual, and also it uses the assessment method to grade that complaint at either a grade 1 or 2 and fix appropriate timescales to those grades. It's taken the best practice from lessons learned from the Ombudsman's websites and guidance, but also from the best practice that's within the legislative processes for complaints handling. So within adults and children's social care, taking the best points of those and putting it into our corporate approach. Can I have the next slide, please? So again, moving on to the main benefits of the change to the policy and procedures. It'll meet the increasing challenges, as we've mentioned in the previous agenda item. There's a rise in number of cases, but there's also more complex cases coming through. Make sure that we can get our information and the timely implementation of actions from complaints back to the individual. So again, touching on those questions that you raised earlier around lack of action, and Kath's response around communication is key, and getting communication right and keeping information, complainants and customers up to date as we go through that process. It'll quickly help us to identify themes and improve the opportunities that we have to learn lessons and support service areas to make changes where they can make changes, or to explain to customers why those changes can't be made for that particular time. Can I have the next slide, please? Again, we will be able to share these lessons learned and actions to the Audit and Governance Committee through our regular reports to those. Those reports are obviously made public. We also have a dashboard that's published on York Open Data Platform, and we're looking at working with business intelligence as we move forward with this new approach to improve in what information we put and make publicly accessible, so that people are more informed about the performance and how we are doing as a council. The other opportunities this new approach would give us is it removes duplication of work across the council. As you can imagine, even though with the best ways of monitoring, spreadsheets do pop up all across the place on timescales and who has what complaint to deal with. And it's about looking at how we can streamline and avoid that duplication of work. It'll give us the opportunity, as the team will do, as the corporate governance team, so the complaints advisors will look at the end-to-end of dealing and responding and investigating to a complaint. This absolutely enables us to provide that independent and impartial oversight of a complaint, and to ensure, similar to how the Ombudsman would work, is that we provide recommendations and outcomes of our findings for the service area to consider and look at and make a decision and determination on. And also that last point there, which I've already mentioned, which is take the most out of the opportunities that how we've responded to COVID-19 within the corporate governance team. So that's supporting service areas in the end-to-end delivery of complaints, investigation and handling and responses, where we've seen a marked improvement in the performance of timeliness of responses and understanding by the complainant of the nature of the complaint handling. Can I have the next slide, please? So this is just a proposed timeline, and some of the January ones might have moved slightly. Obviously, we've only been able to get to yourselves and it's February. We are continuing to review and update the website and the internet requirements if all the proposals are accepted. We will look to further enhance the training and identify where the training needs to happen. The training will be mostly building on the expertise and knowledge and skills that the current advisors in the team have, because they do currently do investigations and support investigations where they have delegated authority, mostly at stage 3 and a lot of times within adults and children's social care. So they have a wealth of knowledge and experience that they can push forward and take forward into this full end-to-end provision of all complaints, investigation and responding to. So a lot of the training will be raising awareness with other services in the council to ensure that they understand how the complaints or the 4Cs are being dealt with now, and that how we can support them to make the best use of any investigation findings. We'll be looking to attend more DMTs and team meetings to continue to promote and raise awareness. Those won't stop after we go live with this, hopefully on the 1st of April. Those will continue and right up to the point where we are given the update and review to Audit and Governance Committee on how the first 6 months of the process and proposals have went within the council. It'll also be an opportunity to continue to go back to DMTs and keep that circular loop of learning from complaints and feedback there across all the council. And I think that's the last slide, apart from over to you, it's questions. Oh, that's just apologies that I haven't amended the header to this committee's name. And that was just to draw your attention to the point in the paper where we were asking you to either make comments, give us feedback, or as Janie said, we can arrange to have a discussion outside of this meeting if you have more detailed question that you wish us to take you through. Next slide, please. Yeah, I was right now. Any questions?
Thank you for that. That's really helpful. I think Janie or Dawn can just confirm for me. The paper does have options in it at paragraph 7, but I believe that they were the options that were presented to A&G and are not for this committee to consider.
No, there were options for A&G to consider. A&G unanimously, as you've just seen, accepted proceeding with the new complaints toolkit. What we did is we didn't want to cause, because this is so detailed, we didn't want to cause any confusion really, so we just brought exactly the same report so that there wasn't different versions being circulated around.
Yeah, that's fine. Thanks for clarifying. So I'll just throw over to members for any quick questions, but as Janie said, there is the option as well to go through more detailed questions outside of the meeting. And Councillor Rowley, you've got your hand up there.
Thank you, Chair. Thank you, ladies, all three, for the hard work you've done on that. As with anything new, it's easy to present what the new document will look like. It would just be interesting to get a précis from you, just a brief email précis of what's different. So in other words, what was in the old one and what is now new in the new one, rather than just a whole new package, so we can then see how robust the procedures are. Yep. So just the new changes. Thank you.
We have, Chair, just put at a glance changes, which appears at page 137 of the agenda. So Audit and Governance Committee found that quite useful. Rather than take you through the myriad of documents that we've provided, I think it's at page 137.
Yeah,
there is
I
an
only got as far as
135. Oh, there is an at a glance table, which does the compare and contrast. So hopefully that assists. Can I just make a comment? Just the member of the public who spoke at the beginning of this meeting talked about the emotional health impact it had on her. This is not an uncommon concern that has been raised with myself and Lorraine and Kath. Part of the toolkit is to take away some of the rigidity and offer those who submit a complaint that greater flexibility, so that they remain in control of their complaint rather than feeling that they've been done to. It's more of working with us, and we want to make sure that they get to the right tribunal or the ombudsman at the quickest time possible, so that they don't have this legacy of a complaint hanging over them for months and months, or I think the member of the public mentioned about 3 years. So part of this toolkit is to try and acknowledge that, yes, we're acutely aware of not just the sort of like physical impact, but the emotional impact that complaining has on a person as well.
Thank you, Janie. That's helpful. I'm not seeing anybody else with their hands up, so unless anybody is nobody's jumping in, so I think I will just say thank you very much to Lorraine and Kath for that information. As you say, the kind of summary of what has and hasn't changed at page 137 is really helpful, but if members did have any further questions, they can direct them to Janie, I guess, in the first instance, and we can go from there. So Kath and Lorraine, thanks for your time this evening. You're now free to leave the virtual table, and I will take us all the way back to agenda item 4. Thank you. Good evening. Take us back to agenda item 4, which is the public health update from Sharon Stoltz, who is Director of Public Health and who is hopefully joining us now. And members, just while Sharon's joining us, my plan is to take this item and then have a short adjournment after we've gone through this item. So as you know, Sharon has been giving us a monthly update. Just so that members are aware, Health Scrutiny is meeting tomorrow night, and Sharon's also attending Health Scrutiny. So myself and Councillor Doughty, as the chair of that committee, have discussed a little bit and agreed that his committee will focus on looking at things like the vaccine rollout, the non-COVID health impacts, and things like cancellations of routine surgery and wait times and those questions of that sort of nature. So when we're questioning Sharon, if you could just sort of have in mind that there is a second bite of the cherry, as it were, tomorrow night. But Sharon, if you could perhaps give us the presentation that you circulated for us earlier today, and then I'll invite members to ask questions.
Yes, thank you, Chair. I'm hoping technical support, yes, we'll be able to manage this. So so next slide, please. this is what I'm proposing to talk about this evening. So say a little bit about the outbreak control plan, give you an overview of the local picture of the pandemic locally, what's happening with our case numbers, etc. Say something about outbreaks in care homes and schools. Talk about testing and contact tracing, and then highlight for you key issues that are emerging that we're doing some targeted support with at the moment. So on to the next slide, please. So we have an approved outbreak control plan that was approved by the Outbreak Management Advisory Board last summer. That outbreak control plan is based around 7 national themes that you can read there on the slide. And then in addition to that, we have 2 local themes around communications, our local communication strategy and mental health. The outbreak control plan is due to be refreshed for April, and so there'll be an opportunity to bring that updated plan here if the committee wishes to see it. So on to the next slide, please. This slide shows what's been happening with the picture of the pandemic in York. So as you can see, York is the red line there, the dotted line, England, and the green dashed line, the region. So as you can see, we are just coming down the end of the 3rd wave of the pandemic in York. And as you can see, each of these 3 peaks has actually grown larger. This really high peak of infection that we've seen in York towards the early January, we believe was partly due to the new UK variant of the virus that we know is more infectious. And I'm going to say a little bit more about that later in the presentation. So as you can see, our rate shot up very, very quickly. We were, over a couple of weeks, we had the highest infection rate in the Yorkshire and Humber region, and spent a number of weeks above both the national and regional average. But I'm very pleased to say that we're now coming down the other side of that quite quickly. And our rate today is 164.8 per 100,000 population, which is lower than both the regional and national rates. So going on to the next slide then, this shows us what's been happening across age groups. So when we saw the last peak of cases, that was largely driven by people in the younger age group, the 15 to 34 age group. What we've seen in the most recent spike in cases is that we saw an increase across all age groups. And as you can see in this slide, we're now seeing a downward trend in all age groups. The age group that we're seeing the highest rate of infection at the moment is the orange line, which is the 30, or the amber line, which is the 30 to 54, or rather 35 to 49 age group, which is similar actually to other local authority areas as well. So on to the next slide, please. This shows what's happening with our positivity rate. So this is the proportion of COVID tests that come back as positive. So, and I'll say a little bit more about both of these. So the PCR tests is normally the tests that are undertaken in people that have COVID symptoms. But in York, we're also working with the Department of Health and Social Care to put targeted testing in those areas of the city that we've seen higher rates. So we've currently got mobile testing units in at Acorn Rugby Club and also in Haxby. Those tests are open to people that don't have symptoms of COVID as well. And so the impact of that is that it's lowering our positivity rate for PCR. So at the moment that shows 6.41%, which is lower than the England and regional average, but just a little bit of caution around that, because as I say, there are some asymptomatic people accessing those tests in those two localities of the city. The lateral flow tests then are the rapid symptom-free testing that we're doing. This is a little bit out of date, this data. Our local figures show that we've actually done over 20,000 rapid tests now. But only the this only talks about the positives that have been inputted into the national database, which gives a positivity of 0.44%, which is very similar to the national and regional rates, so not much difference there. On to the next slide then, which shows where York sits compared with other local authorities across the Yorkshire and Humber region. So as I've said earlier, we spent a number of weeks at the top of this league table, but as you can see, with our falling rate, we now are falling down that league table. And if we carry on as we are, hopefully we'll be able to reclaim the position we held for some months last year, which was at the bottom of that league table with the smallest number of cases. Going on to the next slide then. The open data platform, if any of you go in to look at that, shows case rates by medium super output area, or MSOA as we call it. And certainly the York Press and York Mix, for example, publish those MSOA rates as well. Increasingly, as a public health team, we're using ward-based data, which we think gives us a more accurate picture of what is happening across the city. And as you can see there, with each of the wards broken down, the ward that has the highest number of cases at the moment is Fulford and Heslington, and then we have Heworth without at the bottom there. We keep a very close eye on this and engage with ward councillors if there is a ward with particularly high rates, to have discussions with them about any enhanced testing that we're going to do in those areas. So moving on to the next slide, which shows what's been happening with hospital activity. So there's always a delay in us getting the information through around hospital activity. So this shows figures as at the 4th of January. And as you can see the first peak of the virus there back in the spring, very low numbers over the summer, We had a little bit of a peak then in November, which fell, and then you can see the most recent peak of hospital activity that was considerably higher than the number of admissions that we saw in the first wave. Fortunately, hospital activity is now starting to fall, although as you can see with the bottom line, the orange line, we're still seeing a fairly steady number of patients in intensive care. What I would expect to see as the vaccination programme rolls out is that we start to see a much better stabilised position in terms of hospital activity. On to the next slide then, and I know there was a question about this at the last meeting. So this slide shows that since the start of the pandemic, we've had 140 excess deaths in York. So that is excess deaths compared to the average number of deaths that we would expect to see compared to previous years. And you can see the red bottom line there is the COVID deaths. I know the question last time was whether we're able to break that these death statistics into a more granular level of detail. We can do that, but it means going back to look through the ONS data and the local registrar's data as well. And because we've been so busy with the spike in COVID cases that I just showed you, we've not had time to do that detailed analysis as yet. We do plan to do that detailed analysis, a detailed health needs assessment of this, looking at causes of deaths. And I would hope that that would be ready in April time to be able to share that with you. On to the next slide then, looking at settings. So we're showing an improved picture in terms of care homes in the CYC area there. Just 6 care homes that we're working with at the moment. A number of these care homes with cases are picking up asymptomatic cases with staff and residents through regular testing. We still do weekly testing of staff and monthly testing of residents. But where we are concerned about this, we will go into a care home with the infection control team and do a deep dive into what's happening in those care homes. So very close observation of what's happening with care homes, and we will do remedial action with any that we're particularly concerned about. As we know, not all children are in school at the moment. So what this shows is that we have 28 children of primary and secondary school age who have tested positive, but that will include children of this age who are at home. They're not necessarily in the school environment. So on to the next slide, please, which shows what's happening with our local contact tracing. So we've looked at this slide before as a committee. The red line shows when our local contact tracing commenced. As you can see, the service is actually doing very well, and the most recent data shows that since the start of local contact tracing in October, we've actually actioned 96.4% of the contacts that have been transferred over to us. However, there is a concern around the number of contacts that we are not able to speak to face to face, either over the telephone or a home visit. And I'll say a little bit more about that in a moment. So the next slide shows some information about the UK variant. There's been a lot in the media recently about different variants of the virus. And I think it's important to say that all viruses mutate. It is quite common. The flu virus mutates every year. And there are currently around 100 variants of coronavirus. What we do, though, is Public Health England will look at any new variants that are cause for concern. And there are two variants in the UK that are cause for concern at the moment. The first of those is what we call the UK variant, or the Kent variant, which started down south. We know that this variant is the predominant variant of the virus in York. It's responsible for over 81% of the positive cases that are detected through PCR. And indeed, the UK variant is rapidly becoming the most dominant variant. You will also then have read in the media about the South African variant. We do not have the South African variant in York. There are 2 known cases in Scarborough that have been linked to travel, and that those 2 cases have been contained, and there are no concerns about a potential outbreak or spread from those 2 cases. From the surge testing that has been taking place down south, it was announced today that there have been 147 cases of the South African variant picked up through that surge testing. It's important to recognise that the vaccines that we have are effective against both of these variants. Vaccines are intended to stop severe illness and death, and both of these variants are susceptible to the vaccines that we have. So just to give that reassurance there. On to the next slide then, just to give you an overview of some of the enforcement activity that is taking place across York. So there is a daily community safety hub review that is comprised of the public protection team, so Matt Boxall's team, the community safety team, and North Yorkshire Police as well. And at that daily meeting, they look at any cases that have been brought to attention of businesses that are not following COVID rules, about any concerns there are about people gathering around takeaways, or any anti-social behaviour that's COVID or non-COVID related. And so that wasn't particularly joined up at the start of the pandemic, but we've been integrating our response as a council with partners, and now that daily community safety hub is working very effectively and responding to any concerns that are raised with us. And then I thought you might be interested in seeing a snapshot of some of the activity that the COVID marshals have been undertaking. So This is just a snapshot up to the 27th of January. And as you can see, even though the COVID marshals have been with us for a relatively short period of time, they're doing a great deal of very valuable work, and a 99% satisfaction rate there with the service. So that's a really important part of our pandemic response. So on to the next slide, please. Just a bit of an overview for vaccinations. I'm not going to go through this in any detail. It's just really here to give you a snapshot of how successful the vaccination programme is being in York. So over 99% of residents over 80 have now received the first dose of the vaccine. A high proportion of 75 to 79-year-olds, and rolling vaccination out to the 70 to 74-year-olds at the moment, and those that fall into the clinically extremely vulnerable group. And again, a lot of work that's been targeted to care homes as well. So York GP practices have the highest coverage of COVID vaccination in the region at the moment. So that's to be very welcome. On to the last but one slide now, just to highlight some key issues for you. So the government have now expanded testing to businesses with more than 50 employees that can either continue to access the public health COVID testing programme, or if they have more than 50 employees, they can choose to establish themselves as a local testing site. And so public health will be working with any businesses that wish to set themselves up as a testing site in the same way that we did with schools, to support them around that, to offer training and quality assurance, so that we can be confident that that is a really effective testing program. I mentioned some of the concerns that I have at the moment around a significant number of people that have been tested positive, so they should be isolating, but we're having difficulties in contacting those individuals either by phone or via home visits. So we're talking of 256 individuals that we haven't been able to either speak to or visit. That's a cumulative number. Obviously, that is a concern, because if people have tested positive and they're not socially isolating, then that can spread the virus across York and lead to further outbreaks, which is obviously something that we want to stop. And so we're doing some work at the moment around enhanced contact tracing. We're going to be not just offering 2 telephone calls followed up by a single home visit. We'll be doing follow-up home visits, and also working with the community safety hub that I just talked about, to look at what more we can do around compliance with social isolation. The government is due to publish this month its roadmap out of national lockdown, and that will be important once that roadmap is published to inform our forward COVID testing and contact tracing strategy, but also our recovery strategy as a city. So there'll be further work to do once that roadmap is published. And as I mentioned earlier, there's also the refresh of the York outbreak management that's planned as well. The next slide then is questions, but it's just occurred to me, Chair, that I've not given an update on one of the other issues that came up at the last meeting about the lateral flow testing pilot within the highways team. So if I give a quick update on that now.
Yeah, just so that you're aware as well, we have got Neil Ferris coming later in the agenda, and I'd specifically asked him to give us an update on that particular aspect. So do feel free to give us a little bit of something, but members will have an opportunity to ask Neil some questions as well.
Well, it was the public health team that did the pilot, so probably
I don't want to steal your thunder at all. So
no. I mean, basically, this was a pilot of what's called test and release. So rather than socially isolating all contacts of a positive case, we did a pilot with a highways team of contacts where we tested them daily. And if they tested negative, we allowed them into the workplace. That pilot, I would say, was partially successful. We did actually pick up one positive case from that pilot, which led to concerns that someone might have been in the workplace for 2 days, and on the 3rd day they tested positive. So there was a concern that they might actually have been infected the 2 days that they were in work, but the test hadn't picked it up. And then the other issue was really, it was very time consuming to do the pilot. So the report that went to the council management team and to executive members, portfolio holders, suggested that we wouldn't do this again routinely. That it's too labour intensive and we don't have the capacity within the public health team to be able to do this. So the recommendation was that we would do it on an exception basis with the agreement of the corporate director and myself. And so we would not do it as a routine, but on an exception basis if we felt that that was necessary. So that was the outcome of that piece of work. So I'm happy to take any other questions, Chair.
Thanks a lot for that, Sharon. That's been a really helpful and really thorough update there. So there's a few hands going up. There's just one quick question which I wanted to ask because you mentioned it, and I think it would be useful just to have it in the public domain. You were saying about the discarded face masks being collected by the COVID marshals, and it's a question that I get asked as a ward councillor quite often. Is there guidance about how people can or should safely collect discarded face masks? Should they not be collecting them and just be reporting them? And have, is there a way of perhaps conveying that more widely in the city?
So we shouldn't have discarded face masks in the city, should we? And I find it outrageous, quite frankly, that people would just drop them because they are a source of infection. So I would advise members of the public, advise against members of the public picking up face masks. They are a potential source of infection and they need to be handled carefully in accordance with infection prevention controls. So I would advise members of the public to report any discarded face masks. They can report them either to the COVID-19 helpline or to the public protection mailbox. And then through the community safety hub, we can deploy COVID marshals or others to pick up those face masks and dispose of them safely. But my plea would be to residents and visitors to the city, don't drop them in the first place. Put them in your pocket, put them in your handbag, take them away home with you, and just put them in your household rubbish.
Thank you. That's helpful. I think it might be helpful if we could perhaps request that the comms team just puts out something with those contact details for who to contact about removing them. And what I'm going to do now is just take everybody's questions in the order that your hands have gone up. But I'd like to try and keep this question and answer session down to about 10 minutes if we can, because I'm very conscious that we are running over where I'd hoped that we might be at this point of the meeting. So just in the order that you've put your hands up, it's Councillor Rowley first.
Thank you, Chair. Sharon, I will keep this really brief, but just to proceed what I'm going to ask you. 12 months ago, I emailed you when this coronavirus first reared its head in China, and asked you how prepared we were in the city in the event that it came to York, and your optimistic response was that hopefully it won't do, but if it does, we are prepared and resilient. And I just want to commend you and your team that you probably didn't think you were going to have the last 12 months that you've had. So just a massive well done to you and your team for all that you've done, and also moving forward. I think that you've been very, very robust in what you've done and the way in which you're doing it. And so thank you for that. My question, you may well have covered this in your presentation, so forgive me if I've missed it, but it's the testing. You put a key issue, expanding testing to businesses with more than 50 employees. Just in terms of the frontline workers that we have in the City of York Council, did you mention about what testing we have, as a council for our frontline workers? And if you did, forgive me. I was just curious as to what the situation is with our own frontline workers.
So our workforce already have access to testing. We encourage anybody who is accessing symptom-free testing through the rapid devices to be tested twice a week, every week. So it's not a single test, it's an ongoing test. And so at the moment, anybody who is living or working in York and cannot work from home, in whatever sector they work in, are able to access one of our 3 council testing sites. So we now have University of York, York St John University, and also this week the site opened in the Comedium Stadium complex in the leisure centre. So they're open to everybody already, but the government have made an offer to, if there are any businesses with more than 50 employees, they can set up their own testing sites if they wish to.
Councillor Rowley, is that supplementary?
Well, thank you, Chair. And I wanted to hand over to everybody else. Sharon, there are some organisations that have compulsory testing for their employees. Do we have compulsory testing for frontline workers that work for the City of York Council, and is it something that we should be thinking of?
So it's voluntary, in the same way as in the NHS and in care homes it's voluntary. In this country we've taken a policy, a national policy, that testing and vaccination is voluntary. Obviously, we strongly encourage staff to take that up. But unlike some other countries that have gone down a compulsory route, that's never been the approach that we've taken to testing and contact tracing in the UK. And so it's voluntary, but strongly encouraged.
Thank you, Sharon. So next was Councillor Mason.
Thank you. I'm aware of time, but I've got a few questions and points. We had a meeting, the police and crime panel in January, and at that point they're saying the police didn't have access to any kind of weekly testing or any lateral flow testing. And I just wondered if that position had changed, or if there was any support the council were giving to the police to, obviously, even if it was using our own capacity. I'll raise the points quickly and then hopefully you can pick them up. The next one was around age grouping. So when you gave us the report earlier, they were in kind of 15-year age bands, and I wondered if there's any figures that show it by kind of maybe that might correlate. So kind of primary school, secondary school, university, and then after that, I suppose we're not really bothered. Maybe we might take the retirement age onwards, but it was, I suppose, particularly down at the younger end. Obviously, you said that you would do the pilot again with them, if it was needed. But so I presume you think it's clinically kind of it works, I suppose, was the question, if you're going to continue it. And then just again about our own testing facilities, what kind of capacity are they running at the minute? Are they being well used? Are they only half used? What's the kind of capacity as we kind of again move forward with this roadmap? So hopefully you can remember those 4 points.
Yeah. So in terms of police testing, what we've done across North Yorkshire and York, both local authorities have given access to the police for testing. What we've done in York is we've said that police don't need to book an appointment. They can just drop in. So if they drop in and show their ID, that's much easier for them. They can drop in when they're driving past or whatever. Yeah, we've certainly expanded it to them.
How long has that been running for, if you don't mind me asking?
Oh, couple of weeks,
okay.
I think.
Okay.
And we're also exploring the possibility of home testing. Rather than them having to go to a testing site. So that's something that we're exploring as well at the moment. Not quite there yet with home testing, but we're exploring it.
Brilliant.
In terms of age groups, yeah, we can break the data down into smaller age groups, and I'm happy to circulate that to members after the meeting, so I can send that round by email. Very happy to do that. I just included the overview slide, but it can be broken down into smaller age groups. In terms of the test and release, clinically it can work, but only in controlled conditions. It wouldn't be something that I would encourage people to do it without the oversight of public health, because we need to be absolutely certain that the test has been done correctly, that the test result has been read correctly, and that we can confidently allow that person into the workplace. So it needs to be done in a controlled environment, which is one of the reasons why it's quite time consuming, which is why we're not rolling it out more widely. In terms of capacity within the testing sites, they are being very well used, which is one of the reasons why we've opened the third testing site. So we'll now have 3 public health run testing sites. They are used quite well, and now that we're extending that to more and more groups, if people do as we've asked and they get tested twice a week, every week, then we're confident that we have enough capacity to be able to cope with that demand, and indeed can look at developing further sites if we need to. But we think we have enough capacity at the moment.
Brilliant, thank you.
Thanks for all that, Sharon, and well remembered. It was a good volley of questions there. Next up, I have Councillor Pearson.
Thanks, Chair, and thanks, Sharon, for the report. I just want to say thank you ever so much to you and your team for setting up the local testing site in Haxby. Councillor Hollier and I went for a COVID test, and thankfully both came back negative. I'd be interested to know if you had any like early statistics or updates on those particular testing sites where there's asymptomatic testing. And on a second point, unfortunately, my sister, she works in the York District Hospital. She unfortunately has got COVID, but she's been transferred to the COVID wards at York Hospital. And despite having full PPE in her normal day job in the endoscopy ward, in fact, her matron was in the York Press recently talking about the stress that staff are facing. Despite being transferred to the COVID ward itself, she then did not have full PPE on that ward and was using the same disposable masks you might be able to buy in the supermarket. And I just wondered what kind of conversations you were having with York Hospital and keeping track of what the hospital are doing to stop the spread.
So in terms of data, statistical data from the testing sites, for the 3 sites that we run in public health, we have very good data because we collect that ourselves. Where we've got the Acorn Rugby Club's testing site and the Haxby testing site, because they're run by Department of Health and Social Care, we provide them the site, but we don't run it. They're not our staff, they are Serco staff. We're finding it a bit more challenging getting data from there. But we have some data I can certainly send to you as ward councillors, if you would like that. Very happy to share what we have outside of this meeting. And I can get Kate to forward that on to you. In terms of PPE, all health and social care providers follow the current government guidance around PPE, and that includes York Hospital. So there are national guidelines around the level of PPE that is required under certain circumstances, and that's what all hospital trusts and other NHS providers are required to follow. I am aware of the lobbying that's taking place through professional groups to argue for that guidance to be reviewed, with a view perhaps from some professionals that it's not adequate for the circumstances in which they're working. That isn't a local decision, it's a decision that's made nationally. The NHS issues that guidance, and they rely on Public Health England advising them of that. So it has been reviewed nationally, and my understanding is that that review said that the level of PPE is still adequate. But obviously, if staff have concerns, then they need to raise that through their health and safety representatives and their trade union representatives to lobby with their own employer if they feel that there are issues around that and they feel unsafe.
Thanks, Sharon, and I'm sure that everybody on the committee would be wishing to wish your sister all the very best for a speedy recovery, Councillor Pearson. I've got a couple of further questions from people, and then I'd like to wrap this section up. So I'm just going to take Councillor Fenton and then Councillor Kilbane. I think if we just go straight to Councillor Fenton, and then Sharon, if you can give us a fairly succinct response, and I'll do the same with Councillor Kilbane.
Right. Quick question. Where do you think we are in terms of better understanding why York was harder hit than other local authorities in the region in terms of the most recent spike? Thank you.
So the best answer that I've come to after reviewing all of the evidence is there were 2 things that were happening at the same time. One was that York was in a tier 2 area when other areas were in tier 3, and so we were subject to fewer restrictions. And we know that we had people travel in from tier 3 areas that were breaching those tier 3 guidelines that they should still have been working to. And also the new variant of the virus, the UK variant that we know is infectious, got into York before it got into other parts of the region. So our data was already showing that over 70% of our positive tests were coming back from the new variant, when in other parts of the region it was as low as 30%. So it was those 2 things. We're in lower restrictions probably allowed the new variant to get into the city, and then because the new variant is more infectious, it just took off. And took off faster in York than it did in other areas. That's what caused the spike. What we know, of course, is that York as a city is very good at controlling our case numbers. And so what we're seeing is those case numbers now coming down again.
Thank you, Sharon. And final question then from Councillor Kilbane.
Oh, thanks, Chair, and thanks, Sharon, for that presentation. All the work you're doing. I heard you on Radio 4 last week. Was it The World at One? Is that right? I thought you did us proud. You spoke very well for the city. Thanks for that, and thanks for the excess death data as well. It was me who requested it. I'll hang fire on that until we got a bit more granular detail, but fully understand how busy you are with other things. My question is, what do you think the impact's been on the concentration on COVID, on the other public health issues, trying to tackle substance misuse, smoking, obesity, that kind of thing? What kind of impact do you think the concentration on COVID's having in those areas?
So obviously it has an impact because as a public health team, we've had to divert, or I've had to divert resources to respond to COVID. We've continued with our statutory public health responsibilities, so sexual health, substance misuse, etc. What has been sacrificed, if you like, are some of those non-statutory public health services that we've had to park. And we're now doing a piece of work as a team, hoping that our numbers are going to fall even further, about how we start to pick up some of that work again. I mean, if the committee would be interested in having further information about the wider impacts of COVID on public health services and public health outcomes for the local population, I'm happy to bring that presentation back at a future meeting if it's something that the committee would be interested in. So yes, it's obviously had an impact.
Thank you very much, Sharon. That's been really helpful, and I think there's one or two things there that you've said that you'll be able to bring back or circulate to committee. So we'd welcome that. And just to reiterate, I think some sort of comms around what to do with the discarded face masks and things, I think would be really helpful. But otherwise, I think it just leaves us to say thanks again for all the work that you're doing for the city, as various members have commented upon. You're now free to leave the virtual table. I'm sure we'll see you again very soon. And members, I think what I'll do now is move us into a short adjournment. I make it just a little bit before 5 to 7. If we could come back onto the main meeting just a little bit before 7 o'clock, with a view to us being started on the live feed at 7 on the dot, that'd be really good. And if you could just be switching off your video feeds now, follow the instructions, and we'll see you all shortly. Right, welcome back everybody to this evening's meeting of Customer Corporate Services and Scrutiny Management Committee. We are pushing on through a fairly hefty agenda, so I won't hang around in inviting Ian Floyd, who is the Chief Operating Officer, to join us for the next item, which is item 5, an update on Council and how we've been responding to the latest lockdown. Just before I hand over to Ian, I'd just like to thank him and the other officers who have been waiting on the call very patiently since 4:30. I'm conscious of your time, so over to you, Ian, if you could perhaps just give us a summary of where we are, and then we'll invite members to ask any questions.
Yes, thank you, Chair. So I'm just going to give you a very brief overview, really, in terms of some of the things that Council has been involved in. Clearly, since January, really, it has been a particularly busy time, and obviously you've heard Sharon talk about some of the issues. We've had clearly a multitude of things to deal with, so clearly the lockdown commencing and the impact on schools, and Maxine can talk more about that later on. The new business grants that we've had to administer, and the closure of some facilities as a result of lockdown. As Sharon described, cases have increased in January, and that has meant additional pressure, in particularly on the hospitals, and that has then reflected in terms of demand for adult services. So the adult services team have been working particularly to high levels and working very closely with colleagues in the NHS. We've also, as members be aware, had flooding in the city and the need to manage that with public health advice at the forefront. And of course, we've also had the budget deliberations, and papers on the budget are being discussed at Executive this week, and then, as you will all be aware, go on to Council later this month. And in addition, clearly, as to the normal difficulties of setting the budget, clearly this year has been a very difficult one and a very unpredictable financial position. So lots of things going on clearly across the Council. I'd like to, I think, recognise the huge commitment that staff have given and their continued commitment across all areas of the Council. Staff have been fantastic throughout the crisis. It has been clearly a very long stretch, and particularly, I think, coming back after the Christmas break, there were concerns about, staff morale. Would staff come back with the same energy? But I have to say, staff have continued to respond, continue to support each other, and they continue to step in, provide cover where it's needed. And I think if I go back, there's certainly a couple of weeks during January where we faced all the things at the same time, and the commitment from staff was absolutely amazing. So supporting staff, ensuring we look after their well-being, their motivation, very much continues to be a focus for myself and other senior officers. Clearly, service has been operating where they can do, still either out in the communities, or clearly we've got a lot of staff who continue to work from home. It's not just COVID that we have to deal with, of course, and so there are many day-to-day services, many statutory services that we continue to do, and many new issues, major policy items, which we are dealing with. And I think just to give a brief overview of some of those, some of the things we have brought to this committee before, others you'll be aware of. So senior management restructure is ongoing. The assimilation process has been conducted, and then we will be continuing through HR process for that. You'll be aware in terms of issues in terms of unitary government across North Yorkshire. We are expecting government consultation to be announced fairly soon. There will then, if the government stick to a timetable, be a decision in terms of the unitary structures for North Yorkshire and York in around summer, and clearly that does have an impact potentially on the elections for the county council. Any new unitaries couldn't be created, we think, until April 23 at the earliest. I mentioned elections, and clearly you'll be also aware that the government have very recently just announced that elections will go ahead. As you will also be aware, we don't have local elections, but we do have the police one to deal with. It's fair to say we don't usually get a high turnout for that one, but still there are some issues that we'll need to obviously manage if the elections do still go ahead. Lots of work has been going on with the NHS, clearly, in terms of the crisis. I think it's worth also highlighting that we are also involved in terms of looking longer term in terms of how we work with partners in the NHS. There are some changes in terms of how the NHS is structured and operated, which will come into play April 22, but the year leading up to it, we do need to look at how we are working together with them. So lots of things happening, but building on what Sharon said, I think hopefully we can look to it in a positive way going forward. And clearly we are starting to look at plans around longer term recovery. We know there'll be many impacts that residents will face, partners will face, and businesses. So whilst there's still a lot of uncertainty still in terms of how the next few months will go, we do know that there will be lots of things that we will continue to work on and continue to need to respond to as hopefully the impact of COVID does reduce. So we've obviously got the economic impact, and York has shown that it is still somewhere people want to visit. And I think we can go forward with some confidence, but that's not to say there are not going to be challenges in terms of the economy of York. For our residents, clearly we know they've been impacted by this in many different ways, and there'll be a big task to support our residents in terms of, you know, jobs, in terms of issues, in terms of support to adults, children's, our communities, and we know the impact in terms of mental health and some issues in terms of the education of our children. And then as an organisation, we need to also look at how we will move forward, how we will return to the office, in what way, what transition periods there may be in terms of how many we can get into the office, how we might use technology going forward, and striking the right balance between how we use technology, remote working versus people being actually physically present in work is a challenge which faces ourselves, but also clearly many organisations. So I think just to stress clearly and to conclude, there are many current challenges, but many future challenges that we need to address. But I am confident that the council is able to respond to those, but clearly they will present ongoing challenges, not just next year, but actually for years to come, I suspect. I'll stop there, Chair.
Thank you very much, Ian. I think there's something slightly funny going on with the mute and unmute buttons, so I'm hoping that the technical team can resolve that. I think you were probably having the same problem I was having,
Yes.
which was every time I clicked it, it was telling me that I couldn't unmute and that the host was not letting us. So I'll just kind of tread water for a moment or two, hoping that the technical team are able to just sort that out and invite members to just indicate if they want to be the guinea pig to see if they can unmute themselves to ask the first question. And I see that Councillor Musson has duly volunteered. So over to you, Councillor Musson.
Can you hear me?
We can, thank you.
Thank you, Chair. So it appears to be only you two. I don't know what's going on then. So my question is sort of, it's a little bit vague, but hopefully you can just give your impression as to what you think the impact of it is. So I kind of wondered, from your perspective, what are the potential impact on staff well-being of any recruitment freeze or, you know, non-vacancy filling, whatever the policy is? Does that mean that we have, you know, lots of staff whose workloads are going up? what are the impacts that has on staff wellbeing? And I know obviously we have this COVID-related sickness absent report coming next, which explores a lot, you know, sickness absent related to having COVID. But then I think maybe a dimension that might not be in there, which I'd also like to explore, is sickness absence related to stress related to the impact of COVID. So if you could give any impression as to whether there's impacts on staff wellbeing as to any of these policies and how the council is mitigating those, that would be very helpful.
Yeah, I think first thing to say, I mean, clearly this affects people in many different ways. So there's not one single answer to the question. On the recruitment freeze itself, we don't as such have a recruitment freeze. What we are doing, and have been doing, is just given we did face, you know, some difficult financial situation this year, and, you know, looking ahead to, you know, setting the budget as well, is just to ensure that there was a robust process whereby if posts became available, that they were properly considered. And one of the reasons for doing that was to make sure that we didn't want to be bringing people into the organisation and then to be making people redundant a month or two later. And clearly, as I said, there was some uncertainty in terms of the overall financial position. Just to stress, we are recruiting to many posts, particularly critical posts in children's services, adult services. So it's certainly not a recruitment freeze in any shape or form. It's just simply that we are going through a proper process to make sure posts are filled. In terms of staff well-being, I think we've put that very much at the forefront since the beginning of the pandemic. We do regular communications, regular staff sessions. We encourage managers to obviously keep in touch with people. There's information goes out from myself to all staff at least 2 or 3 times a week. At times we've done it every day. So there's a lot of communication going out there. I think, you know, clearly the pandemic and worries around it affect, you know, many people. It's clearly an issue. I think all we can do is keep, you know, working on it, seek to support staff as much as we possibly can. And absolutely that, as I say, is a top priority for myself and other managers, to make sure we support them and recognise that, you know, sometimes people are going to be struggling in terms of this.
Thanks, Ian. Councillor Musson, was that a supplementary?
Yeah, it's just a supplementary question on that, which is, I guess, what are you doing to increase awareness of the employee assistance programme to all the managers that might be, you know, in the position where they need to support someone who's going through those kind of wellbeing issues? Because I work in a similar organisation with a similar programme, and my experience is that very few people know that it exists, very few managers know that it exists, and it is a great tool that people could get some benefit from. So how are you increasing awareness of that amongst the whole council?
We in the messages that go out from myself, which say, I mean, at the moment they're twice a week, but have been more frequently at times, there is a repeated links in terms of how staff can access wellbeing information at a variety of sources, and that also includes, you know, things we've seen from other organisations, other external links. You know, Trudy could talk more about that if you wanted further information, but we repeatedly provide information for staff to be able to easily access a range of wellbeing support.
Thank you. And Councillor Kilbane.
Oh, thanks, Chair. Can you hear me? Can you hear me?
We can indeed. I think the muting problem has been resolved. I think there was a setting that was changed that's now been changed back.
Okay, because my settings went a bit funny then as well, but never mind. Okay, yeah, thanks, Chair, and thanks, Ian. Thanks for the update. What are we doing to make sure that we can provide services to residents that don't have internet access?
I mean, it varies clearly. I mean, it depends on what services you're talking about. But clearly, we will always try and deal with people, whether it's on the phone. In terms of in person, clearly that is difficult at the moment given the rules. But in essence, if anyone has an issue, they can always ring the customer centre, and we will always try and make appropriate arrangements to deal with somebody if we can do that via the telephone. Clearly, a lot of traffic, a lot of people go through the internet, and that has increased, certainly, I think, in recent months. But our general policy is, if you can't access services via the internet, we will always seek to provide services in a different way and cater for individual needs.
Thank you, Ian. I'm not seeing any other hands up at the moment. So I just had a question. You touched on the sort of corporate restructure that's been ongoing and the various sort of phases to that. And then you also did a really helpful sort of summary of all the kind of things that were going on within the next calendar year in terms of what the local authorities are going to have to face and challenges and things coming up. The one thing that you didn't mention was the local plan, and obviously the inspector had said that there was going to be, I think, some further hearings in the summer. And I understand that part of the restructure may affect the team that is sort of managing the local plan, or at the top end of the local plan. And I just wondered if you could give us any thoughts about how confident you are that we'll be in a strong position by the time we get to summer to be able to deal with the inspectors' queries or the things that they want to see, if there's a restructure that's sort of ongoing at the same time as that.
Yeah, I mean, Neil's on the call as well, clearly, so he could probably add a bit more detail. But in terms of staffing issues, we've been very clear that the planning function, but also in particularly the local plan team, will get the resources it needs to be able to deliver the local plan. Within the restructure, there is a phasing. So there is the retention of an assistant director within the Directorate of Place for 6 months period. The local plan team is also going to report directly to Neil, and clearly that will be one of Neil's top priorities in terms of making sure, first of all, the team has got the adequate resource to deliver, and also that we make sure that is achieved. So it remains a top priority. I don't see the restructure in any shape or form affecting it as such, and we'll make sure that it doesn't. And whatever resource we need to get the local plan over the line, we will find it one way or another.
Thanks, Ian. And I see we've been joined by Neil Ferris, who's the Corporate Director of Economy in Place, for anybody watching. Neil, I don't know if you wanted to just add anything to that, or if Ian's summarised it sufficiently.
I think Ian's absolutely summarised it sufficiently from a CYC perspective. I just reflect to members that the plan has been submitted to the planning inspectors, so we're now in their hands in terms of the pace and the content of the public inquiries and how they wish to manage their process. So in terms of absolutely, we're committed as an authority to support them in them managing and delivering that local plan inquiry, but the pace and the speed and the content of the inquiries is a matter for the inspectors to lead on. I'll just highlight that to members.
Thanks, Neil. I'm just looking for any further questions, and I'm not seeing any at the moment. I'm sure that the ongoing corporate response to COVID will be something that we'll be discussing for as you mentioned, Ian, potentially many years, one way or another. Although hopefully the immediate effects of the pandemic will not be with us for that long. In which case, without further questions being indicated, I will thank you very much for your time this evening, Ian. Neil, I think you're staying with us for the next agenda item as well. So apologies for the long wait that you had there, Ian, but it is appreciated you coming to join us at Scrutiny. Thank you very much. And so I'm now moving us on to agenda item 6, which is the sickness absence report. We've been joined by Trudy Forster, who's head of HR. You've got a report here to speak to, I think. So I will hand over to yourself just to give us the overview. And then I think Neil was here specifically to look at what we touched on earlier with Sharon around the testing within highways.
Okay, thank you, Chair. So it's agenda item 6, page 5 that I'm speaking to. So my plan is not to go through the report in full detail, but just pick out a few of the main parts for us. So it is purely a kind of sickness absence COVID related report. So I know I come on a regular basis regarding health and wellbeing in general. So this was just picking out the COVID specific. The graph that's shown on page 6 shows those sickness absence rates since March of last year, with obviously a significant increase at the start. And that's when people were displaying symptoms and self-isolating, but the testing of staff at that point wasn't readily available when it first started. The sickness absence rates then has followed the national and local infection rate patterns. And as you can see, as we've gone through kind of wave 2 in October time, and then obviously kind of the wave 3, I think it's wave 2 and 3, at the end of December, beginning of January. There is some confidence in that whilst the rates have increased in kind of beginning of January time, we've not reverted back to those rates that we were at the beginning of March. That's quite positive. There are staff that are isolating but are fully, because they're working at home, they're able to fully continue to work. So those individuals that are self-isolating or are positive for COVID but are well enough to work haven't reported sick, and therefore those staff will continue to work, be that at home, but they won't also obviously be included in those figures. So the graph's there on page 6 for you. Just to give some confidence about how we support staff who do report sick with COVID related absences, be that self-isolation or positive. That comes into the day 1 absence line. So I know we're interested as a committee around that day 1 absence reporting. And that gives us real live information to HR. So as soon as that person's reported absent with COVID related, that comes through to my HR team, and my colleagues pick up the telephone and speak to those individual members of staff to ascertain, are they a home worker, are they part working, have they been out and about, have they been in work, have they been in contact with colleagues, and that discussion around that, and making sure that they've got the relevant access to support, and that the manager's there as well supporting the staff. That is then passed on to our public health team, who are doing a great job, and they do that local track and trace for us. So again, if there is any, but if there have been in the work environment, then in terms of if there's any other members of staff that need to self-isolate, we will make contact with them immediately, and that stops the spread in terms of that track and trace process. The process obviously isn't done in isolation, it's done with the supervisors and managers being aware, so there's some knowledge and mechanisms in place to ensure that the services are still provided, and Neil can give a bit of that background in terms of economy in place. We haven't got any concern that there's any transmission of the virus within the workplace. We've got very good control measures around a lot of our buildings, inside and out, and we've introduced recently the wearing of face masks within council buildings at all times, except for when it can be removed while sat at your desk. And then there's a lot of the other hands, face and space guidance that we've all heard. Obviously they're very key to our provisions within the workplace. Testing, and again, I think Sharon's covered it in her kind of briefing, so we've covered quite a bit of this. We are encouraging staff that aren't 100% of their time working at home to access the symptom-free test sites, and again the 3 test sites that are available in York, and we are piloting with public health the provision of home test kits soon, and seeing how that works about providing our staff with that access. Obviously when we get a positive result from that, I did point at point 15, I did say that when you get a positive result from the lateral flow that they need to book a PCR test. That's now changed. The government guidance temporarily is that if you get a positive test from the lateral flow test, you don't need to go and have a further test. So that's changed temporarily. Vaccination. So we have started vaccinations across our staff group within that first priority category of health and social care, working very closely public health, HR and the CCG and NHS Trust to make sure we can get those staff through. And we have passed around 900 names to them. We don't currently hold the information around which staff have received the vaccine or not due to the GDPR aspects involved. And also, as Sharon's mentioned, that as a country, we haven't got the policy where it's compulsory vaccinations, so we need to bear that in mind. We are liaising with managers to establish an estimate of who's received them, so we will have some figures hopefully in the future around estimates of staff being vaccinated. Just going on to the wellbeing side of things, obviously as a committee you're very interested in the health and wellbeing of staff, which is great, and we come with in previous meetings I've come with all the health and wellbeing measures that we've put in place. They still continue. We do buddy schemes, we're doing all of the support around kind of keeping active and all of the mental well-being support that's available. As you've mentioned, I think we said we've got the EAP service. We do promote that. We've got staff sessions on a regular basis that Ian leads through, and those are happening. We do blocks of kind of over a 4 or 5 week period, and they happen every 2 months, and we get a couple of hundred of staff through those sessions, which is really good. We have manager sessions, we have manager briefings, we've got wellbeing group established, we've got manager drop-in sessions. So there's an awful lot going on there to support the wellbeing of staff. We've launched the Keeping Well in 2021, which was launched the last couple of weeks, and that had a number of courses for staff to go on, including Let's Go and Laugh and How to Sleep Well. I must say I viewed somebody doing the Let's Go and Laugh one, which was very entertaining. So we've had over 150 bookings to that, and as always we continue to look at ways to support staff, and we do get a lot of staff just coming forward on their own, really, to myself and colleagues and Ian direct about ideas of what they want to see introduced. So I think that's probably covered the kind of overview report from a COVID related absence perspective, Chair.
That's really helpful. Thank you, Trudy. I think what I'll do is just invite Neil. I know that Sharon did mention a little bit about the testing that had happened within highways. I don't know if you want to just add anything further or any of your thoughts on that, and then I'll invite members just to ask any questions of both of you.
Okay, so I'll just pick up a few bits to give some local flavour to what Trudy's told you about the corporate response. So yes, the figures in E&P, as long as the authority reflect those in the broader community. And I think what we were very much conscious of post-Christmas was that increase in the contagion rates, because we've got the new variant in the city. So that triggered Trudy colleagues and my management team undertaking a risk assessment review of all risk assessments across all the authorities' action areas, further inspections of premises, so Hazel Court, West offices, wherever people were working, further inspections undertaken, and they were taken by health and safety and public health colleagues, just to ensure that we were really on the top of our game and making sure that all measures were in place. Trudy's mentioned we've introduced masks in all CYC premises, and for frontline staff we've given a snood type option, because obviously working in a hard physical environment outdoors all day, that's a more convenient way for face coverings to be worn. When we came back from Christmas, obviously we had a blip in rates, and I'll talk to that in a moment, but highway staff are very critical to the operation of the city in terms of winter gritting. Obviously our blue light services rely on being able to use the arterial routes around the city. So we instigated a bubble approach to the whole highways gritting team, which meant that those staff were effectively dedicated to the gritting service and were not asked to come into work to undertake their normal daytime duties. That has worked very well and has now been reviewed in light of dropping cases and the control measures we've got in place. And we've split those teams now into smaller bubbles, and those staff are now working on their day-to-day duties as well as winter gritting. But that emergency measure was taken right at the start of the year to put the whole gritting team or a whole gritting team into a bubble, and therefore not requiring them to come into work and the potential infection scenarios. The situation we faced first week back after Christmas was that we had 5 service supervisors who were either diagnosed with COVID or self-isolating with COVID, or because self-isolating because of COVID. We had a fantastic support from our public health team, who effectively instigated, as Sharon has indicated, a rapid response with a lateral flow test and release approach. So effectively, those staff who were self-isolating, so not the ones that have been diagnosed with COVID, those that were self-isolating were able to undertake daily lateral flow tests. And as long as they came in negative, they were able to come into work and supervise the staff. It's obviously for a relatively limited period, because self-isolation is for 10 days. And obviously once those staff have been well enough to return with COVID, they did so. So we were looking at about a fortnight where we were relying on the test and release programme. That was reviewed by CMT and by Public Health and was considered to have been a success, but a success in an area where we had a critical service that needed to be maintained, and therefore the risks associated with the test and release process were warranted. And it certainly worked within health, within waste and highways. And that's a quick summary of where we are and what we're doing. Oh, sorry, one more, just again to reflect on Trudy's point. Really for Councillor Musson, where members of staff do have difficulty working at home because of their home environment, they are all able to make an application through the HR team and to their managers to come into work in West offices, and we've made arrangements for a specific number of staff who have got difficult home circumstances.
Thanks, thanks both for that. I just want to quickly acknowledge that Martin Rowley has had to leave the meeting to join a parish council meeting. So he had notified me in advance, but I didn't acknowledge that he left just at the start of this agenda item. So over to questions, and Councillor Fenton, you've got your hand up there.
Thank you, Chair, and thank you, Trudy, for the report. Just picking up on the vaccinations issue, obviously has been mentioned a few times. It is a voluntary programme. I just wondered what steps we were taking as an employer to encourage those members of staff who have been identified as being in one of the priority groups because of their occupation. What steps we've taken to encourage those staff to get vaccinated. Thank you.
Thank you, Councillor Fenton. So we've done encouragement via the emails and via managers speaking to staff, encouraging those staff to come forward. At this point, I've not had raised to me from a kind of head of HR perspective that we've got any significant numbers of staff refusing to participate. Actually, we've got more staff who are more than eager and want to be on that kind of priority list and get their names through to the NHS and CCG for vaccination. So I think most of it's done via the line manager, really, Councillor Fenton, in terms of that encouragement. As I say, we're not getting any significant feedback that that's not being taken up at this time.
Thank you. I'm looking for any further questions, but oh, Councillor Kilbane, I was just about to say not any there, but Councillor Kilbane's jumped in with one.
Okay, thanks, Chair. I think my internet's slightly unstable, so hopefully I'll stay. The overall, the absence figures seem to have improved. Sickness absence if you look at over the whole year, and obviously discounting the initial sort of COVID absences, which is great. I'm just wondering how much of that do you think might be down to presenteeism? You know, people clocking in for working from home when actually they are ill. And if we've got any way of recording that and measuring that, finding out if people are or aren't doing that.
Thank you, Councillor. I think this has been raised before in some of the previous discussions at committee, and it's difficult to measure. I don't think we've got any ability to say how many people in effect at home log on, but you're assuming that they're not well enough to work. I think some of it is around you'd expect that from a line management perspective and colleagues in terms of staying in touch with people, and if they're really not well enough to be at work, then they shouldn't be. I think a lot of staff that are working at home are often on meetings such as these, or team meetings, or via like customer services where they're taking certain stints on the kind of telephone lines, etc. So I think there's always that measurable point about people working or not working. So that would be a line management. There's nothing that there's no corporate central solution to kind of measuring that. There's no clocking in system. I'll pass to Neil for kind of from the service perspective.
If I might, Councillor Crawshaw.
Yeah.
I can just comment really of my own experience of my heads of service, my assistant directors, and the staff that I talk to on a daily basis. It's the whole COVID thing, as Ian has said, has affected people in very many different ways. But it's certainly brought a sense of family and responsibility for each other throughout the crisis in respect of staff. And one of the things that we do encourage is effectively to people to put their cameras on. And I can say that, when anybody is saying that, well, you look under the weather, those conversations do happen. There's not a sense of people working in isolation for days on end where there may be, as Trudy's rightly pointed out, it's very difficult to understand whether they're ill or not, and there's presenteeism. For me, the proof is in that camaraderie, that relationship that's really come together because of COVID, and that's both on a professional and a personal level, because everybody realizes that we're facing this together. So I'd say it's probably actually less of that than there would be under potentially normal circumstances, because we just naturally are caring for each other more in these difficult times.
Thanks, Neil. Councillor Kilbane, did you have another substantive question there?
I do. I mean, it's related, but it's a different question. What are we doing to support parents or carers who are homeschooling?
Yeah, so we're obviously, it's a difficult time for those of us that are homeschooling as well as working. We're very flexible in our approach. So what we've said this time is that we've allowed people to flex so that actually people can still do their contracted hours, but they're able to do that at different times of the day and potentially at weekends outside of normal working hours where the service permits that. We've had no difficulties or responses back from staff at this point in terms of doing that. We've also allowed staff to use their flexi leave and annual leave where appropriate to flex that in terms of that support for homeschooling and childcare.
So just supplementary on that, is there any gender breakdown on that? As in who is using their flex? So in other words, working at night time or at weekends so that they can homeschool during the day?
We haven't recorded it, so we're not recording it on a central basis because it's not a permanent change to contracted hours. That is done at a local level with as Neil says, in terms of the supervision and management teams managing that basis. That there is the option where staff, if they wanted to temporarily reduce contracts or change their contracts, then we'd allow that, but nobody's come forward to do that. So that would be the only time that we'd have that data available, Councillor.
So just to get, can I just finish off clarity? Essentially what you're saying is they could reduce their contract hours if they found it all a bit too much to be homeschooling all day and then working at night.
So if they wish to temporarily reduce their contracted hours, then yes, they could do that.
So I think Neil was wanting to add something, and I saw Councillor Musson's hand waving with the supplementary question as well. So Neil, I don't know if you wanted to add something to what's just been said, or if not.
Yeah, it was just to add to that piece there. What I do see an awful lot of is sharing of responsibilities within families. Certainly, we've got, and that's male and female. Councillor Kilbane. So, we'll have members of staff who are flexing on a Monday and Tuesday, and then their partners are flexing on a Wednesday and a Thursday. So they're sharing the workload, both as homeschooling and effectively the abnormal hours that they're choosing to work. So again, I see that across quite a number of staff within the authority.
Thanks, Neil. Councillor Musson.
Thanks, Chair. It was just come up on what you said, Trudy, about staff taking flexi and annual leave to account for their childcare needs. What's the policy on special leave for childcare needs? Because in effect, if you're doing childcare, you're not getting a break, and then if you're using your annual leave to do childcare, that's going to have a real impact.
So we've got emergency domestic leave, I think it's called, so that's available as well. But like I said, I think the majority of people are just flexing when they're doing their hours. So we've not had a huge, it's not been flagged to me from a kind of HR perspective across my teams that there's been a lot of people taking those kind of annual leave and flexi leave and time off in lieu in terms of providing childcare. And as Neil's rightly kind of pointed out as well, there is a lot of, I know just from the people that I'm in contact with, there's a lot of sharing of that responsibility across the household, between the carers of the children.
Thank you both. I'm not seeing any further hands going up, and I think that probably is quite a nice sort of neat segue into the next agenda item, which is about schools and that sort of thing. So unless anybody is urgently wanting to, and I'm not seeing that, so thank you very much, Neil and Trudy. I appreciate you had to hang around for a long time for a reasonably succinct item, so I do really appreciate your attendance this evening. So if I can move us on then to agenda item 7, and likewise apologise to Maxine and John, who I think are both joining us. So we should be being joined by Maxine Squire as the Assistant Director of Education, and John Tomset, who is somehow upside down, which is quite fantastic, guys. I've not seen that one. There's always something new on Zoom. I've not seen that one before. So John is the head teacher of Huntington Secondary School, but also here in his capacity as Chair of York Schools and Academies Board. Do really appreciate the time that you've had to wait this evening, so thank you very much.
Okay, thanks.
Maxine, I think perhaps if I could just invite you to speak a little bit to your report, and then
Yes.
John, if you're perhaps in a position to give us a bit of a summary of what the Schools and Academies Board has been up to, and then I'm sure that members will have questions.
Thanks, Johnny. I am going to just do a very, very quick overview of the report, because I know you've had a very long evening, and also I know that members will have read the report in quite a lot of detail. What you asked me to do was just give a quick overview of what's happening currently in schools, and with particular focus on how they're operating during this third national lockdown. As throughout the pandemic, all schools in York have remained open. So our schools have been open since March 2020. Open in different guises, obviously. So as with first national lockdown, the schools are open just to the children of critical workers and vulnerable groups at the moment. What we've seen with lockdown 3 is the decision was taken, obviously, to lock down very, very quickly, and right at the point when schools, well, certainly our secondary school head teachers, had spent most of their Christmas holiday working on the testing, the lateral flow testing, which was required at that stage to actually go into a phased return to opening schools after Christmas. And then, within a day, we got the news that we were going back into a March-style lockdown. What I would say is that because of the York context in early January, schools were a lot more anxious than they'd been in earlier stages of the pandemic, and that's because it had really come home that the cases were accelerating in York, and it felt very different to the previous 2 periods of national response. And it did create greater anxiety within the staff teams in schools. And obviously that led to some schools having Section 44 notices being put in around health and safety. And it was purely an anxious response, I think, to the fact that York felt very, very different. It wasn't because our schools were actually doing anything differently to the measures that they got in place pre-Christmas. And it's important to remember that our schools were operating as fully open between September and December, using control measures which were very successfully controlling the spread of the virus. And they'd done that hand in hand with the public health teams. So the thing that had changed after Christmas was the sudden spike in the cases in the city. And that really made it feel different, and it made staff feel more anxious. I think as well, it was suddenly hitting people that we were in for the long haul and people were tired. Christmas had been quite disrupted, and as I say, it meant that it felt different this time around. But as they've done throughout, schools responded really positively, very, very quickly, and again returned to the measures that they'd had in place earlier. I think now, just as we're approaching half term, then their well-tried health and safety routines have kicked in again, and schools are operating as close to normal, given that they've got reduced numbers at the moment, as they've been doing throughout the pandemic. Really central to that has been the work that's gone on through the York Schools and Academies Board, and I'm going to leave John to say a little bit more about that, but that's been really crucial to the way that schools in the city have operated throughout the pandemic. We get a daily return on attendance, which is submitted to the DFE. And that has shown that throughout this pandemic, attendance across York schools has stayed above the national average for all groups and continues to do so. So that as of today, both the numbers of critical workers and the numbers of vulnerable children in our schools remains above the national average, well above the national average. And that, again, is a tribute to the way that schools have operated throughout the pandemic. We also get a daily return on confirmed COVID cases, again reported to the DFE, and the number of staff absences. On Friday, there were 92 teachers that were absent from school. 8 of those were confirmed COVID cases. And that's a pattern which has been similar throughout December, January and into February. It's been looking at round about 8 to 10 confirmed cases, and that's across 63 schools. People have got close, but nobody's actually got to the point where staffing levels have fallen to such an extent that has meant that we've had a risk of school closure. Not since January. Throughout the pandemic, we did have one school that did have to close as a result for a short period as a result of staffing levels, and that was a very small primary school. But up to date, and touching wood, schools have been able to maintain safe staffing levels and keep their arrangements in place. The other thing that's been different in lockdown 3 is the statutory requirements around providing remote education. And although the remote offer has been a feature of the pandemic, it's now being defined as a statutory requirement with set hours that need to be delivered. Again, it's been really impressive the way that the school community have responded to that and developed their remote learning platforms. What's also been very impressive is the way that school colleagues have supported each other in sharing what they've been doing and developing new ways of working, which have very, very quickly been put into place. It was interesting because I remember a YSAB meeting where someone in just an off-the-cuff remark actually said, and it was a primary YSAB meeting, that it really brought it home, we weren't paid to be CBeebies presenters, and yet that's almost a skill set that we've had to develop in very quickly in the last few months, and people are becoming more and more comfortable with the way that they're delivering online. I know councillors have been very concerned about equity of access to the online offer. It exercises school leaders as well. It's one of the things that they spend a lot of time thinking about. A number of our schools have spent their catch-up money to ensure that they've extended the remote access to children that they know are struggling to have the right devices. We've used the DFE ordering line as a city to get more devices allocated, and we've also got colleagues in the community furniture store who've been running the ICT reuse scheme, and that's also open to all schools now to signpost where families are approaching them and saying that they don't have enough devices in the family. So we're trying to avoid the problems of families who are having to share devices. But again, there's been a big citywide effort. People have been overwhelming with their kindness in terms of wanting to donate devices. We've just been having to do it in a way that we can get them to young people, but also that the devices are set up in such a way that they're of the correct specification with the correct safeguards in place to be able to access the online offers that schools have got out there. But every single school leader is very, very well aware of the impact that this is having on children and young people, and they want to see them back in their schools as quickly as possible. That I think that's the worrying bit. What I'm hearing is teachers who really want to get back to business as usual as quickly as possible now. I'm going to leave it there for John because he can say more about that.
Thanks, Maxine. I mean, Maxine said 99% of what I aim to say, but I'll say a couple of things. I'll say something from the point of view of being a head teacher and something about being the chair of YSAB. I can't stress enough how much we want to be back in school. If you read my blog that I wrote at the weekend about teaching a lesson last week online, and just the difficulty of the whole thing. Zoom is great. Try Teams. Teams is a shocker. And I was supervising year 10 this morning, and we got about 8 or 9 year 10s who come in, critical worker children of critical workers or vulnerables. And I started getting lots of emails from different people in departments. And I asked the students, is Teams playing up? And they said, yeah, it's awful this morning, sir. And like across the school, I guess across the nation, everybody logs on at the same time on a Monday morning, and Teams hasn't got the capacity to cope with it, even now, this far into the lockdown. So we just had to set work for them to do and try again period 2. So all those barriers in the way, no matter how good your internet system is, and we have the Vital company on site, 50 yards from my office, and yet we still get into problems. And there's some quirky things. It's actually, we've sorted a great deal of our disadvantaged students' connectivity with the machines. So the DFE, to be fair, have provided something like 70 Chromebooks. We've bought another 50 Chromebooks out of the support money. We've got enough Chromebooks and stuff to support our disadvantaged. And if they haven't got connectivity, we've employed 2 TAs to print. I think it's about 70 envelopes a week go home to students who haven't got connectivity with hard copies of the work they've got for the next week. So that's happening right across the piece, right across our schools. But it's actually some well-heeled families who have found actually they've got 2 professional parents at home wanting huge amounts of broadband because they're in meeting after meeting after meeting. They might have 3 students of 3 or 4 children of school age all needing a device, and there's just not enough devices in really quite affluent homes. So there's all sorts of levels of nuanced complexity about providing the offer that we're giving. Huntington, I decided very early on in January to not overpromise and underdeliver. So we've built up our online live teaching, whereas some other schools who started straight off 5 hours a day live teaching from the 5th of January have had to scale it back because it's just not sustainable. The students are finding it hard, parents are finding it hard to support. I've got a member of staff who's got 3 children of primary school age. He's trying to teach from home. They've got a 6-month-old child. He's trying to teach from home, and the primary school has asked him to sit with his 3 primary school children to help them do their learning 3 hours a day as well. So the complexity of the demands on our staff has been extraordinary. And then from a YSAB point of view, we met from the first week in March all the way through to July, pretty much without 1 or 2 exceptions, 3 times a week. And I chaired that all the way through Monday, Wednesday, Friday. And we now have a pattern of meetings in the autumn term, which is still now in, where we meet as a group on Friday. And then between that, we have a primary school meeting and a secondary school meeting. We also have fortnightly meetings with the associations, with the trade unions. And that has been brilliant. I think what you found is that as a citywide educational community, we've come together designation blind in the pursuit of supporting each other and delivering the best we can for our young people. I have deep concerns about the grading process. Just to warn you, the grading process, I think it's extraordinary what's happened with the decision so quickly to cancel exams. But as you get deeper into this lockdown, you realise it probably was the best idea. But who knows how we're going to grade people this year? It's a real issue that I think lots of big brains are really wrangling, kind of wrestling with. I think the issue is, last year, what happened was that everybody realised how grades are set, and they didn't like it. But we have used algorithms, we've used historic performance year in, year out for setting grades. Now the government got so stung by their incompetence last year, they don't want to even talk about grading in terms of historic performance, and yet that's how examination grades have been set for the last 3 decades. And we really have a problem if we don't have some kind of comparative outcomes from primary school performance when we get to GCSE and A-level. So that's a big challenge coming up. But the good news is, yes, every cloud and all that, and the silver linings, is that I don't think the educational community in York has ever felt so united as it feels at the moment, which has been tremendous to be part of. Happy to take questions.
Thank you both very much for that. And if I can just take a minute just to sort of echo as well some of what's been said there. You know, as a parent of primary age pupils, the effort that my kids' school have gone to, and I know the local schools in the area have all done, you know, it has been phenomenal. I'm sure that's being replicated right across the city. And as a governor of my kids' school, I know that the staff have certainly really valued the input that they've had from the York Schools and Academies Board, and that ongoing sort of collaborative approach that you mentioned there, I think is really feeding through, certainly in the experience that I've had personally. So you know, that's really to be commended. I'm just going to throw open to anybody who wants to ask questions. Just before they do, I'm going to ask a quick question first. In my position as chair, got to use my discretion now and again. You mentioned about devices and about access to devices, and I think it's really important to highlight, you know, that where you've got people needing 4 or 5 devices in a home. The thing that you didn't mention was data. And I think that that's been a concern of mine is on the one hand, you provide a device, but on the other hand, if you don't have sufficient data to access the internet, that can be equally challenging. And perhaps how you ask people about whether they've got enough data is also a challenge, because if you're used to communicating via email, they can't really reply to say they've run out of data. So I just wondered what thinking there had been within the Schools and Academies Board, whether there was a role for the council in terms of making sure that the messages are going out.
If I reply to that, Maxie, I don't know if you've got anything after me, but certainly we've bought lots of dongles and distributed dongles where they're needed, and we have our full pastoral team in, and we have our full list of our most vulnerable students, and this is replicated across all the schools, and we make weekly phone calls, and we have relationships with our most challenged and most vulnerable families. That mean you can just say, do you need any help? You know, I was looking at one this morning where you know, clearly, I don't really, you know, we will find the money afterwards, and I have put some money here and there, but there's a family in deep need, and they will get supported financially, you know, because what else do you do when they ask you? So there's a whole range of things there, Johnny, but I think from our point of view, the dongles and that is fine. The paper copies are important too if we haven't got the data, and we all have resources for our most vulnerable that we pay extraordinarily to support.
Yeah, Johnny, I'd echo what John's saying. We meet twice weekly with the maintained school heads, and one of the things that we've raised with them is to let us know if there are families in need around data, because we can start to look at how we can improve access to that through some of the work that our IT team does. we've also as well heard from them that for some of them, they actually really like the vulnerable children to come into school to collect the physical learning packs that they've been putting together, because it's another way of just keeping in touch and checking that they're okay. And so they have been encouraging them to come and collect physical resources so that they've got that ongoing contact with school. If they're feeling that they're not able to come into school for any reason, it's keeping that relationship going.
Thank you both. So over to questions. I've got Councillor Kilbane waiting.
Oh, thanks, Chair. Thanks, Maxine. Thanks, John. You'll have to excuse me, Maxine, if I've missed this in your report, but I couldn't see it, but it has been a long night. Do we know roughly how many kids are attending schools on a daily basis? I know it's going to change every day, but roughly ballpark figure, critical workers, vulnerable kids, how many are in attendance?
Yes, in fact, let me just pick it up for you. I have actually got it on my iPad. I'll just get it. As I said, what we do is we get a daily report on attendance, which gives us the latest position. So as of Friday, the number of children attending school with an education, health and care plan, because they're part of the vulnerable group, was 353 out of 831. So that was 42.5%. National average is 37.9. On roll with a social worker, 352 out of 667, that's 52.8%. Nationally, it was 44%. Free school meals, attending school was 661 out of a total cohort size of 3,123. So that's the 5 to 16 age group, and that was 21.7% against a national average of 14%. And overall attendance in York schools was 95%, with 96% being the children of critical workers.
Thanks for that. Can I just get a bit of clarification on that? I was following that right until the end. Are we saying there's about 1,300 to 1,400 kids in school every day?
Yes.
Give or take?
Yeah, give or take.
All right.
Yeah.
Okay, and is that 95% figure, what's that?
That's the overall percentage of sorry, well, I'll just have a look. Settings that have actually been able to provide a place for children. So what we've got is we've got 100% of our settings that schools and settings that are actually open at the moment. Total pupils on site in schools is 3,991 as of Friday.
Thanks, Maxine. That's helpful to have the numbers there, and great that we're kind of above all the national percentages there.
Yeah, and what's really good is that's actually been a continuing trend. So at no stage has that really changed throughout the pandemic.
And sort of following on from that, you meant in your report on paragraph 8, and I guess this might be a question both for the pair of you and possibly slightly for John with his head teacher hat on, but I don't want to put you in a compromised position either with it. The report says that 70% of critical workers on average have been offered places, and I wasn't clear whether that means that remaining 30% have requested places but haven't been able to have them, or just haven't requested the places. And I guess that one of the things that has been difficult in this lockdown compared to previous lockdowns around critical or key workers or otherwise, is that because so many people are back working, and because the government's list has been sort of so big,
wide,
in terms of numbers of people that qualify, it puts the schools into the position of having to make a difficult decision sometimes about you know, is a university lecturer as critical as a nurse on an ICU ward, for example, and that then becomes very difficult. So I just wondered if you could elaborate really as to whether that 70% is of the requested places, and perhaps, John, if you can give any sort of a flavour of what schools are doing to sort of apply that kind of decision making that they're perhaps being forced to make around where they can and can't offer places.
Yeah, it is of requested places. Obviously, one of the things that schools have had to really carefully balance is operating safely. And as I said, the York context was very, very different when we started the third national lockdown, because the pace at which COVID was spreading in the city was very, very rapid. And in order to ensure that the schools could continue to operate within safe public health guidelines, then there were some decisions taken about trying to keep the essential space in school and keeping the number of contacts for adults and children down. So we did work with schools, and our lead member and Amanda Hatton and Sharon Stoltz did write to all parents in the city to say that if you could possibly keep your children at home, please do so, just to help our colleagues in schools do the job that they needed to do and to do it as safely as possible. And some children of critical workers did reflect on the fact that even though it was difficult, they would form childcare bubbles and they would keep children at home. It has varied across our school estate. So as you know, we have tiny village schools where they may be in a village where they've got a high concentration of eligible children. And in the case of one of our very tiny village schools, had they not been able to work with parents to restrict numbers, they would have been over 90% full in lockdown 3. And that's at a time when the virus was circulating very, very strongly in the city. And you've got to remember that staff anxiety was very, very high. So school leaders were having to manage keeping their staff safe, operating safely, and also reducing the chance of transmission. So these things were being balanced. Every single school spoke to their community about what they were trying to achieve. And where parents were coming back to them and saying, look, we just cannot manage this, then our schools were admitting critical workers above what they'd set as a safe operating quota, because they realised that it was important also to work with those frontline workers to ensure that they were able to go and do their job. What I would say is that in the first week, there was a fair amount of panic from parents, because obviously they knew that they had to be in work. They knew that the list had been broadened and they were looking for a school place. And so as a council, the education team were taking a fair number of inquiries where schools were initially working to March 2020 operating procedures, which was that class sizes should be capped. And what you've got to remember is that when this lockdown came in, there was an absence of guidance from the Department for Education. And that didn't arrive until the end of that first week. So many head teachers thought, right, okay, I know how to do this. We went into lockdown 1 and I had to cap size at class size at 15. And many of our primary schools went straight back into that, because it had worked previously and they thought that was going to be the way that they needed to operate again. What they've done is that they're working very, very closely within the limits of their risk assessments. And it is really, really important to recognise that they've worked very hard with the professional associations and the unions to create safe working environments that staff feel comfortable in. They can actually do their job, and the risks of COVID have been diminished as a result. Our public health colleagues have said that our schools have been so successful that they have not been able to say that there's been definite in-school transmission taking place. In fact, that most of the cases have come in from the outside. And that's a tribute to the way that schools have set up those procedures. But it has meant that they've had to be sensible about those discussions with what a safe operating environment actually looks like. Since that first week, we've dealt with no complaints, no ongoing complaints. People have got used to how to work with their school in a blended way to actually access school when it's been absolutely necessary, but also to recognise that many children can stay at home and be supported in the home, even when their children are they are the children of critical workers. That has meant that our schools have been able to prioritise their on-site work with the vulnerable. And in all schools where class size has been restricted, it's been restricted to ensure that the vulnerable have got the school places.
Thanks, Maxine. I don't know, John, if you had anything to add from a sort of an operational point of view to any of that.
Only that it's been much harder for primary than secondary. I mean, yeah, we've got 6% of our children in. That's about 80 students, across the campus the size of ours. The Huntington, which has a capacity of 1,500 students normally, it has been fine. But one of the things that I did was shine the light on the bright spots. A couple of times I've thanked all my, I write to Parents Weekly, I've thanked them so much for keeping their children at home, and reminded them the reason we're closed is about community spread. It's not about protecting teachers necessarily at all. It's about stopping the spread of the virus and from family to family to family. I mean, in the autumn term, we had 19 cases in the school, 15 students and 4 staff, and not one member of staff has had to self-isolate because of the 15 students, and the 4 members of staff all caught it quite clearly outside of school. So there's been no spread, and I know that if I was to contract the virus, for me, who knows how you get it? You go to the supermarket, much more chance of catching it at Morrison's, to be fair, than you have at any of our schools.
And all other supermarkets, I hasten to add.
It's just the one I go to because you get 10% off. No, you've put me off now, Johnny. Now, you've got more chance to do that because what was I saying, guys? On a full flow then. I was saying that there was more chance of catching it. No, I say to parents, I remind them of that, and as a result of reminding them that it's about stopping the spread of the virus, several took the students back out and kept them at home. I said, look, the more students we have in our school, the less live teaching we can do. And if you can keep them at home, please keep them at home. So I think at that week, we lost about 4, but they rang up almost immediately and said, actually, we'll keep them at home next week. You're right. So people have been lovely, and I've had, I had 1 or 2 tricky conversations with parents, but mostly they've just been utterly grateful for what we've been doing, and got email after email of thanks to all our staff.
Thanks, and sorry for throwing you off there. I've got Councillor Kilbane waiting, and I've got one further question I wanted to ask as well. I am very conscious of the time and the fact that this meeting is running on, but I do think this is an important topic area, and we'll never be able to do justice to it in the time that we have. I would just say to committee members, I'm comfortable as chair that we are quorate at 4, so if people do have things that they need to go to, that is okay. But obviously I will be looking to wrap things up relatively quickly. Councillor Kilbane, I'll go to you and then ask my question.
Okay, yeah, thanks, Chair. And I think you're right, John. I think COVID has brought out the best in many of us, terrible situation to be in for that to happen, but it has in a lot of cases. My question is sort of topical, really. Looking at post-COVID world, when we don't need to bubble and we're starting to get back to normal, are you starting to have any thoughts around school opening hours, when they're like what's likely to be, reintroduction of things that people haven't been able to do for a long time, like play sports and singing musicals and all the rest of those lovely things that schools do? Are you having any thoughts on that now? And if you are, will you please share them with the committee?
Yeah, I think I think our main priority, if we have one focus, it's the grading and it's the future of our 11s and 13s and 6s. You know, those transition moments are our massive priority, and we've got a lot. You can imagine we've got 240 year 11s and 160 year 13s who are extremely anxious, and I feel the adults have let them down. We cannot say anything to reassure them, because you've got a government that has stopped the examinations without a plan. And I don't, that's not a criticism, but that's where we are. And I think that has to be our priority. But I was saying today at a meeting this afternoon, we've got to start doing some of the joyful things in school again. You're exactly right, because what they miss most is just being with their mates. That is just true, and we all do that. It's miserable being in school. I go to school, go to my office, I walk around the site. There's some lovely work going on, but it's just a bit grim. And I sit in the year 10 this morning, and there's sitting socially distanced on 8 computers around the room all day. Really, we have a bit of football at lunchtime out on the all-weather pitch, but then they're back in and they've got their headphones on, and I'm sitting there because I've got this bit of software that looks at every screen that I can see what they're on. So when they nip into YouTube to watch a video, what are you doing? But you can't blame them, really, because it's day in, day out, without that social interaction. So yeah, we're thinking of that kind of stuff. The priority at the moment is getting back into school, but once we know it's safe, we're planning that if we come back on the 8th of March, which I'm sure we will do, if it's just 11 and 13, we won't bubble. They will just go to their normal rooms around the school. If everybody's back, we will bubble up till Easter, have 3 weeks, and then after Easter, we hope to be able to put on sport, to put on musicals, to do we did have a sixth form choir going on before Christmas. We just started breaking out and doing those things. And I really, before Christmas, I had a whole load of meetings where I really wanted to be bold. And then, over Christmas, the spike happened, infections rose rapidly, and we're back where we are. I think it's what's frustrating is that you just can't promise anything. 8th of March might come along, but you hear that the Oxford AstraZeneca is no good, particularly against the South African variant. There's 154 cases in the country. That's only got to suddenly take off, and we're in a different situation again. You can understand entirely why the government are very reluctant to put any dates on anything particularly and promise anything of lifting of the lockdown, because if they had to go into a 4th lockdown, I think it would be catastrophic for the country and also politically. So we are where we are. We would love to be out playing football, singing songs, but when that'll happen, don't know.
Thanks, John. And I suppose my question. Oh, sorry, Councillor Gilbane, is a supplementary on that.
Just on operating hours, really. But just to add to that, John, I've got a year 11 and a year 13 in this house, and when the government announced that they were scrapping exams, my year 11 said, "Oh well, I'll see what they say next week." Because that's the level of confidence that a 16-year-old has.
Yeah.
But sorry, no, just more towards Maxine, really. Have we having any thoughts about operating hours of the schools?
Well, obviously, there are some hints that central government will want schools to stay open longer when we get back towards recovery. That it is just hints at the moment that's the case. And what we'll do is in YSAB, we'll start to look at the implications of that if that becomes a more fixed idea. I should imagine at the moment there is lots of work going on in the department thinking about the different variations around phased opening, around how they recover learning time. Yeah, as I say, over the weekend they were leaking that idea that schools may be staying open longer.
If I just come in there, I think Kevin Collins is a brilliant appointment. I know him really well. He's excellent, and if there's anybody you'd want to lead the educational post-pandemic recovery, it would be him. He's fantastic.
Yeah. And interestingly, being the history teacher in the room, a colleague was reminding me of the way in which the children who were evacuated recovered their learning after the Second World War. And actually, they're the generation that were running the country up to not very long ago. So yeah, children are amazingly resilient, and they do. We tend to forget that given the right circumstances, recovery comes very quickly.
We mustn't catastrophize.
Yeah.
Yeah, I would agree with that. But I suppose in the context of that, my question that I had, I'm not sure how it quite sits, but it was around that sort of notion of a recovery curriculum and you know, how the schools will deal with, you know, the impact of this lockdown as children come back into schools. And I know from my own school where you know, the head has shared results of a survey where around half the parents were reporting that their children were sort of feeling anxious, showing some signs of anxiety around being at home and possibly going back into school. And as a parent of primary age kids, you know, certainly my youngest has struggled to adjust to the changing situations in schools. And I just wondered what role you saw both the Schools and Academies Board and also the Council in trying to bring together, I suppose, a combination of best practice, but also thinking about any other partners possibly external to schools. I'm thinking about, you know, whether it's the theatre or the museums or things that can be done that can sort of reinvigorate children's learning in a way that doesn't necessarily catch up on the time that they've missed, but settles them so that hopefully they're ready to learn in the longer term.
Yeah, it's one of the things that we spent some time looking at. I must admit that one of the issues is each time we've looked at it, the government goalposts have changed, and we've actually had to very quickly react to the latest sets of circumstances. But John, through the research school and the colleagues there, have back in September put on some workshops for schools around metacognition and readiness to learn, and how that would be supported on the full return to school. And that was very helpful for people, and a number of schools actually did access that. I think one of the things that I've talked to the Department for Education about very recently is the fact that it's really important to create a space for schools to be told to spend a little bit of time on the conditions, re-establishing the conditions around learning, rather than having to dive straight in to the national curriculum and all that brings.
Maxine frozen.
And I know we have got head teachers in different ways that they can support the emotional well-being of children and young people, and that's certainly being shared around the YSAB table. So it is something that is being thought about. I think we've got a duty as adults to try and normalise things for children and young people as quickly as possible, because that will also help them to manage what has been a very, very anxious time for them. And allowing them to go back to some of the things that they enjoy doing, but also just getting them used to being together again is hugely important. And I took great heart from what happened back in September, because we were actually predicting there was going to be a tsunami of mental health issues back in September when kids got back to school. But the head teachers and colleagues in YSAB were saying, actually, that's not what it feels like. It just feels like the children are so relieved to be back in school and to be back in their classrooms and to be back to some form of new normality. I don't know whether you want to add to that, John.
No, I just think there are some nuanced differences for each year group. You know, each year group has its actually unique issues. So our year sevens, for instance, have been in this tiny little bubble. They know probably a tenth of the campus. So we've got to actually get them, where is room PO6? They have no flying idea where it is. And, they've been in school for half a school year now. So when they come back, we've almost got to start from scratch with them. And then you start looking at 10s and look at 9s. And they've all got, 9s have got their options into 10. How do you do that? We've seen a big drop in GCSE for next September in some of the practical subjects because we've been doing no practical. And that's been so I've got staffing issues there. I've got too many DT and music teachers and not enough business studies teachers. And so we're looking at staffing today. So there's all sorts of new kind of knock-ons that we've got to deal with. But in the end, I think getting them back into school and letting them be a little bit and having spaces for them to go to. I mean, we've doubled, for September, we've doubled our pastoral structure. So our pastoral team have currently 44 non-contact periods of teaching. That's gone up to 80 for September, right? So the capacity there will be huge to support them. We've created 2 new posts of a pastoral head of Key Stage 3 and a pastoral head of Key Stage 4. And that's really significant for us because we just anticipate that you just need that bed of support in for them and spaces. And I think what Maxine said, the liberty to get back and get used to stuff before we crack on with the work.
I think for me, the main concern is the very youngest children. So, we've talked about it a lot, both in YSAB and in Schools Forum, that it's how we actually recover those learning gaps for the 0 to 5s. So it's the early years that I think where we're seeing the most significant developmental issues and lost learning. And, my colleagues in primary, particularly in reception and Key Stage 1, they're most anxious about that because it's that that development of early reading, speech language and communication need. That's really where we need to focus our efforts.
And we are though.
We are.
Rob
We are.
Newton's project on talk in early years is just tremendous. I don't know if you've met Rob Newton yet, but he's a real expert at the early years stuff. It's great.
Well, that's really positive and encouraging to hear in terms of things that we can do to try to address some of the issues that there perhaps may be. And I think what I'll do now is just wrap this up. But just thank you again for the ongoing work and just publicly say again thanks to all the teaching staff across the whole city who I think are working so incredibly hard, and it really is very much appreciated.
The support staff as well.
Yes, sorry, I should say that. Yeah, absolutely. It's the whole school staff. Yeah, I couldn't agree more. Couldn't agree more. So thanks both. You're now free to leave the virtual table, and sorry for keeping you up so late. I know it was slightly later than we anticipated. But thank you.
Take care. Thank you.
Thank you. Thanks. Bye.
So committee members, we just skipped ahead. I'm going to be as quick as I possibly can on these last 2 little bits. We've just finished agenda item 7. We've had 8 and 9. So skip us on to agenda item 10, which is urgent business. Now we had to accept a piece of urgent business because it was contingent, or the budget was contingent. We needed to have dealt with it. So it has been circulated to you all. I'm going to trust that you've all read it. It's around whether or not committee continues to get the £5,000 budget that we have annually for external research and consultancy, and I think we sometimes have had the option to use it for some training as well. Now, we did have some things in place pre-COVID to actually spend some of that budget, which would have been the first time in several years that the budget had actually been touched, and unfortunately lockdown has meant that hasn't happened. I would like to propose that we take option 2, which is to recommend executive retains the current budgetary support for external research and consultancy work, because I believe that certainly Councillor Vassie had wanted to do some external research. We as a committee had said that we wanted to look into some elements of training and that sort of thing, and I know that we've got this, again, Councillor Vassie's committee actually doing some preliminary training around the climate agenda with a view to possibly rolling that out further to councillors. So if you're happy to go on that basis, as I say, I'd like to propose that we retain that and go with option 2. I can see Councillor Fenton with your hand up.
Yeah, happy to second that, Chair.
Thanks. So if I can just ask for a show of hands from everybody that you're happy that we take option 2. I can see everybody, so that's fantastic. That's unanimous. And then item 11 is the ongoing work plan, and I think what I will do is forward to members the work plan that's updated from what's in your agenda pack, and promise you with my hand on heart that next month's agenda won't be anywhere near as long as this one. Unfortunately, we had a couple of items we had to take, and then this item of urgent business as well. So unless there's any further questions or anything else that anybody wanted to discuss on the work plan, I propose that we close the meeting here. I'm not seeing any hands, so I will just thank you all for your involvement in a very long meeting this evening, and we'll wrap it up there with thanks to all the technical staff and everybody who's made the meeting run smoothly.